There's an amendment at the desk. The clerk will report the amendment.
Franson moves to amend Senate File Number 2128, the third engrossment as amended. The amendment is coded A56-1.
To the author of the amendment, the member from Douglas, Representative Franson.
Thank you, Madam Speaker and members. So the A56 in front of you is something that has been in the news a lot regarding how we treated those discharged from hospitals going into long-term care. We take a look at the catastrophe that has happened in New York, Michigan. So this amendment requires the OLA to examine the discharge of patients from hospitals to nursing homes. As we have discussed repeatedly in this chamber, COVID has not affected everyone equally. We know for a fact that the state seniors, especially those living in long-term care facilities, died at a much higher rate than the rest of the population. We know states like New York that required nursing homes to take COVID patients had some of the worst outcomes in the nation. While Minnesota never had a policy of requiring nursing homes to take COVID patients, it did little to prevent those transfers. To this day, despite the clear disproportionate impact among seniors, the state has continued allowing people with COVID to be transferred from hospitals to nursing homes, a culture of death. We should know exactly the impact decisions made by the governor had, and this issue should be at the forefront of that discussion. Thank you.
There's an amendment at the desk. The clerk will report the amendment. There's an amendment to the amendment at the desk, and the clerk will report that.
Hanson R. moves to amend the Franson Amendment to House File Number 2128, the third engrossment as amended. The amendment to the amendment is coded A106.
The member from Dakota, Representative Hanson.
Thank you, Madam Speaker. The A106 amendment is amending the Representative Franson's amendment. Representative Franson's amendment directs the Office of Legislative Auditor to do this audit. And this, unfortunately, has been a trend over the last, say, 10 to 12 years of the legislature directing the legislative auditor to do things where we have the bipartisan and bicameral commission, which chooses evaluation topics. And I'll just put in a plug here for members should be receiving topics for review for voting shortly for that process to begin. So what my amendment does is it essentially, instead of saying shall do, it says Legislative Audit Commission shall consider, which provides for it to happen in the equally balanced bipartisan and bicameral Legislative Audit Commission, along with all of the other topics that have been suggested. I'd ask for your support.
Discussion to the amendment to the amendment.
Madam Speaker.
Is that Representative Franson?
Unless, is there anyone else before me?
No, go ahead, Representative Franson.
Okay, thank you. So members, not exactly excited about the Hanson Amendment. You know, I have been speaking to numerous administrators of the nursing homes and long-term care facilities, and the majority that I was told of the individuals that also had passed away from the COVID were already on end of life care and had contracted COVID for some reason or another, but had recovered past the 14-day waiting period, right? But were still considered as a COVID death. So within that 28 days, I mean, I would like to know, did they die from COVID? Did they die with COVID? Was there a PCR test given? Was it an assumption that the individual had COVID? There is a lot of questions. Like I said, I'm not exactly excited about the Hanson Amendment. I would like to have the OLA do it with this legislation instead of making it a permissive if it was chosen to do so. But I would hope that we could adopt the amendment, the Hansen Amendment. So members, I'm asking you to vote for it. While I believe it is significantly weakened, we do need answers to these questions, and we need to know whether the state could have saved the lives of seniors. So members, please vote to adopt the amendment. And Madam Speaker, I also would request a roll call.
Representative Franzen has requested a roll call on the amendment to the amendment. Seeing 15 hands, there will be a roll call. Discussion to the amendment to the amendment. Seeing no further discussion, the clerk will take the roll.
Oh, man, no, fuck.
Members voting remotely, please vote. The clerk will call the names of all those members who have not yet voted.
Bernardi.
Bernardi votes aye.
Bernardi, aye. Frankie. Frankie. Franzen.
No, sorry, Franzen votes no.
Franzen, no. Garofalo. Garofalo. Hanson R.
Hanson R. Aye.
Hanson R. Aye. Hausman.
Hausman, aye.
Hausman, aye. Mason.
Mason, aye.
Mason, aye. McDonald.
McDonald, nay.
McDonald, no. Nash.
Nash, no.
Nash, no. Nelson, N.
Nelson, no.
Nelson, N, no. Scott.
No.
Scott, no. Swazinski.
Swazinski, no.
Swazinski, no. Thompson.
Thompson, aye.
Thompson, aye.
Ackland changes my vote to no.
Who is that? Have them repeat it.
Could the member who just changed their vote please repeat for the clerk?
Ackland to no.
Heitzman changes.
Wait, no, wait a minute here now.
Just pause for a minute as we give the clerk time.
Ackland is changing from aye to nay.
Yes, that's correct.
Okay.
Erdahl changes from aye to nay.
Erdahl changes from aye to nay.
Poston changes from aye to nay.
Poston changes from aye to nay.
Johnson changes from aye to nay.
Johnson changes from aye to nay.
Heitzman changes from aye to nay.
Heinzman changes from aye to nay.
And then Frank.
Frankie. Frankie, no.
The clerk will close the roll.
It's going to be a tough one to add up here.
With 69 ayes and 63 nays, the motion prevails and the amendment to the amendment is adopted. To the underlying amendment, the member from Dakota, Representative Hansen.
Thank you, members. I'd encourage support for the amended amendment.
To the author of the amendment, the member from Douglas, Representative Franson.
Yes, thank you, Madam Speaker. And sorry, members, I got my notes mixed up there. I'm glad you figured out how to vote on that one. While I said ahead before, I was jumping ahead, but I would ask that you support the entire amended bill now. It's significantly weaker. The delay means us getting the answers we're not going to get. It's my opinion that we should immediately begin the study. There's no reason to wait for the commission to select the topic. The amendment, before it was amendment, would have ensured that we would get the answers we need, but now we have a question mark with the Hansen Amendment. So apparently, Democrats don't want to know whether the state could have prevented the deaths of seniors. And so the Hansen Amendment does just that. We're not going to know. So that's a tragedy. The amendment, as it was originally written, you would have known how many people died unnecessarily by putting COVID patients in nursing homes, and we would have known sooner rather than later. So with that said, I ask that you all vote for the bill as amended, even though it is pretty weak at best. Thank you.
Further discussion? Seeing no further discussion, all those in favor of the amended amendment, please say aye. All those opposed, please say nay. The motion prevails and the amended amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Keel moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A46-1.
The member from Polk, Representative Keel.
Thank you, Madam Speaker. In session in the Health and Human, or the Human Service Health Bill, excuse me, get them mixed up. we heard a bill on the non-emergency medical transport providers. It was changed by the governor, and that is the bill that we're looking at within 2128. This amendment would protect our especially our rural non-emergency medical transport providers, and instead of putting a single administrator in charge of these services, would be, instead of a managed care plan that has been addressed by the governor. When we were in committee, we heard many people come forward that run non-medical transport services, both metro and rural, that said this was not a solution. It has been done before, and now the governor is suggesting we try it again. And it was not successful. Members in my district, people drive just miles, hundreds, 300 miles. Last week when I came down to the legislature, I was past somebody that was headed to Alexandria. So I would suspect that wherever they were driving from was at least 300 miles. We know that the change in the bill to carve out NEMT will hurt providers, because they told us, they over and over again. I think we heard from one group that said, oh yeah, that might work, but our NEMT drivers said, or companies said, this just doesn't work, and wouldn't actually save any money for the state. In fact, it would increase costs. We also heard that the current rates that providers already were being paid was not even helping them with the costs that they had for transporting those who need it. And it really has we heard about the disproportionate impact that it had in the rural areas. There are many people that need to go to dialysis. They can go from Roseau to Grand Forks just to get dialysis 3 days a week. It becomes really difficult to transport. I myself moved an elderly aunt, just for a doctor's appointment. We had to go 85 miles to a specialist, and I could not transport her. She couldn't be moved out of a wheelchair, and so that's how we used the non-emergency medical transport. And this amendment would fix the problems. Instead of hiring a new administrator to cut the NEMT rates, we would now leave the administered program alone, and then provide a rate increase for the rural providers who are already struggling. Like I said, it's very difficult to find. Even they have a challenge finding drivers. But this is a very important program for all of Minnesota. And when we want to talk about providing for those who are already struggling, this is very, very important to them to be able to get to those either medical appointments or services that they would need. And I know, Madam Speaker, that we have other members that would like to speak up about how that affects them. And I would also ask for a roll call on this amendment.
A roll call having been requested. Seeing almost 15 hands. Now I'm seeing 15 hands. There will be a roll call. Representative Keel.
With that, I'll let others speak.
Further discussion to the amendment. The representative from Dakota, Representative Hewitt.
Thank you, Madam Speaker and members. Representative Keel, thank you for bringing this bill forward. As you know, well, in my previous life, I dealt a lot with non-emergent medical transport. It's been a problem for years. It's going to continue to be a problem. We need to fix it. In committee, Representative Keel was exactly right. We saw people bring together solutions. However, the proposal by the governor is a substantial cut. And it's not to service, it's a substantial cut to savings. The unfortunate thing, the companies brought forth a substantial raise. This bill that Representative Keel brought, this amendment that Representative Keel brought forward today would definitely put the bill out of whack. Saying that, I do want her to know that my commitment and the commitment of the committee will continue to try to fix this. This is a problem. It needs to be dealt with. These companies in outstate provide a great service. We just have to come to common ground with them. Thank you.
The member from Traverse, Representative Backer.
Yeah, Mr. Speaker, members, thank you for me allowing to share some experience. I support Representative Keel. As many of you may know, is I have volunteered as an EMT for 25 years. What is going to happen is the individuals who are not able to be transferred regularly will call upon us as EMTs to make a transfer. I'll give a good example. I think it was about 12, 14 years ago, and it was July 4th, the evening of July 4th, and myself and my partner got a call. And no, I think it was the next day. Anyway, long story short, they had a cut, which could have been transferred by another person if, a non-medical transportation, and we had to transfer that person. There are times that we have, unfortunately, anybody as an EMT, and Representative Holt will also know this, that as regular EMTs or paramedics, we have a lot of taxi services. We're not providing much medical care, but no one can get to the hospital unless us for dialing 911. We still have to take those, but it takes us out of what are necessary runs. There has been several times in my 25 years, understand Browns Valley is a small service. We cover 925 square mile area. We cover 3 counties, 2 states, and a tribal nation. And there are times that we have received calls on a run that a non-emergency transport could have done that we're taking, but now we have to call an adjacent agency if it's Sisseton, South Dakota, Graceville, or Wheaton. So this makes sense. I support this because when a true emergency is needed, just like last Friday night, I had a call in which a person dislocated her hip. What was interesting, I was in the back of the rig. She goes, you know what? I helped deliver you. Now you're taking care of me. And those are the runs that I need to be on, not the runs that's a taxi service. So I stand to support Representative Keel's, because in greater Minnesota and across the state, we need the proper care for the proper individuals. And this amendment would allow that instead of taking us as EMTs out of service for a transport or what I call a taxi service, where someone may have a stroke or a true emergency that needs someone of my background. Thank you, Mr. Chair and members.
The member from Polk, the author of the amendment, Representative Keel.
Thank you, Mr. Chair, or Mr. Speaker. I would like to really urge people to vote green on this. Representative Hewitt has commented that it could be out of balance. However, I find it very hard to think that the same program that we are already providing now and financing will be any different, and the savings of dollars have never appeared in the past when this program has been run and changed back and forth from administrator in the Capitol or in DHS to having it run by the different entities out in rural Minnesota. I would point out that many of our rural operators, mine in particular, has told me I'm getting close to retirement. I'm having a hard time financing it. The fuel bills have gone up. The insurance has gone up. COVID was very damaging to them also, even though they were expected, they did go and transport people that could be and needed to be, because you don't stop dialysis even though there's COVID. And we don't have many of those services in the area. So it is vitally important for them. And I fear that if this gentleman decides to retire, that we will have nothing in rural Minnesota. And, while you can drive someone to a doctor's office if they're physically capable of getting in the car, you cannot take someone that is in a wheelchair or needs to have different services at a time of either, just consistency for their care. And it is just a very, very important program, and I think we need to work this out. So I would ask the leadership to members to vote green on this bill and restore what we have now, plus adding a little bit of finance to support these services. Thank you, Mr. Speaker.
Seeing no further discussion to the Keel Amendment, the clerk will take the roll. Members who are voting remotely, please vote. Will the chief clerk call the names of all those members who have not voted yet?
Barr.
Barr, aye.
Barr, aye. Damath. Damath, aye. Hanson, R.
Hanson, R, no.
Hanson, R, no. Hausman.
Hausman, no.
Hausman, no. Her.
Herb, no.
Her, no. Mason.
Mason, no.
Mason, no. McDonald.
Donald, I.
McDonald, aye. Moeller.
Moeller, no.
Moeller, no. Mortensen.
Aye.
Mortensen, aye. Mueller. Mueller, aye. Nash.
Nash, aye.
Nash, aye. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson.
Thompson, no.
Thompson, no.
The clerk will close the roll. There being 64 ayes and 69 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A30-1.
The author of the amendment, Representative Backer.
Yeah, Mr. Speaker and members, what this bill does is the bill currently has a provision that would require hospitals to offer a sale to a local government identity, it could be city or county, before choosing to go and be sold with another organization. This is not necessary. What it really does is it says that, in a marketplace, that hospital should really have the opportunity to work with whoever is best for that hospital and for the community. First of all, nobody wants to see hospitals close, especially in greater Minnesota. The district I represent, 12A, has 6 critical access hospitals. And as several of you know, that is something that's really important to me. I have spoken in the past of talking about hospitals that we got to keep them open. And one of the reasons not to offer a single pay system is would really kill our critical access hospitals. But in rural areas, excuse me, we have to be able to have good driving distance. You know, we have people who drive hours. You know, as an EMT, my closest hospital, if I get a call in Browns Valley, Minnesota, is roughly 20 minutes away. That is if we're running lights and sirens. And that's not good for other people to get their type of medical assistance and so forth. This amendment that I'm bringing up deletes that from the bill. It is so important to keep government out of health care, including government buying hospitals. And I have some other things to say, but first of all, I want to request a roll call.
Representative Backer requests a roll call vote. Seeing 15 hands, there will be a roll call. Representative Backer.
Now, I'll use a good example. Albany, in the city of Albany, they had a hospital that was not doing very well. I believe it was ran by the Catholic Health Initiative, and it could not bring in the revenue to keep the doors. So to think that a city would do a better job, what actually ended up happening, which is what the market does. This is why market does better than government. Actually, what happened to that hospital, the Catholic Health Initiatives sold it to their competitor, and I believe it was Centra Care. I think that's the proper name. And what they did was they made it into a really top-notch clinic. People are able to get good care right in that community instead of maybe driving to St. Cloud or Alexandria, and able to really help folks that way there. So again, I think it's much better for the market to determine instead of government getting the first dibs, because there are private hospitals, and that does a much better job than what government can do. So I would ask for a green vote on this amendment. Thank you, Mr. Chair.
The member from Rice, Representative Lippert.
Thank you, Mr. Speaker. I'm speaking against the A30 Amendment. Hospitals in smaller communities are key community assets, providing critical access to healthcare. If a hospital system comes in and buys a community hospital and then closes it down because it isn't profitable for them, the community has lost that critical asset. And so then if the leaders are responding to a need in their community, leaders in the city, county, or hospital district, and they want to band together to purchase the facility to create a community hospital, they should have the ability to do that, making sure the community has the same access to healthcare. So the original language simply allows the community to be first in line so they can act if they choose. And the amendment takes something very important away to communities and community leaders. So I would ask members to vote no on the amendment.
Further discussion to the amendment. The author of the amendment, the member from Traverse, Representative Backer.
Yes, and one of the interesting things is again, we have a flawed argument to say government could do a better job. I'll give Graceville a good example. Essentra purchased Graceville. It is very important to Essentra to feed their main campuses, Fargo and Duluth, going into them. Stanford has done the same thing, and they can work with the main corporate to help these smaller critical access hospitals. Is it perfect? No, I know it's not perfect. Of course, there are challenges when a corporation takes over things. But there's more of a challenge when a government who does not understand how to run a hospital or community takes it over. So it's really a flawed argument to think that government or county can do it. I do private. It is to Accentra's best best strength to feed their Fargo and Duluth facilities where they do their, surgical procedures and so forth. So I appreciate Representative sharing his viewpoint. I would disagree with it, and would ask for a green vote. Thank you, members.
Seeing no further discussion to the A30 amendment, the clerk will take the roll. Members who are voting remotely, please vote. Will the chief clerk please call the names of all those members who have not voted yet?
Hanson R.
Hanson R, no.
Hanson R, no. Houseman.
Houseman, no.
Houseman, no. Her.
No.
Her, no. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, yes.
McDonald, aye. Miller.
Miller, aye.
Miller, aye. Moeller.
Moeller, no.
Moeller, no. Mueller. Mueller, aye. Nash.
Nash, aye.
Nash, aye. Nelson, M.
Nelson M. No.
Nelson, M, no. Pearson. Pearson, aye. Quam. Quam. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson.
Thompson, no.
Thompson, no. Zhang Jie.
Zhang Jie, no.
Zhang Jie, no.
The clerk will close the roll. There being 59 ayes and 72 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Backer moves to amend House Bill number 2128, the third engrossment as amended. The amendment is coded A20-1.
The member from Traverse, the author of the amendment, Representative Backer.
Yeah, thank you, Mr. Chair and members. In this bill, the DFL proposed removing region hospital's ability to use the state revenue recapture program to collect on its own debt. Excuse me. The revenue recapture program allows the Department of Revenue to capture payment from the state, like lottery winnings and money owed other debts, so they can pay off the debts, or other income tax returns and different things like that. For example, in 2018, the most recent year that we have data, the Regions Hospital provided $56 million in uncompensated care. Some people might call that angel care, or just, Good Samaritan care. And restrictions on revenue recapture will make health care more expensive to individuals who are getting care in regions. What I would like to do is, would Chair Marquardt yield to a question?
Representative Marquardt, will you yield to a question?
Yes, Mr. Speaker.
He will yield. Representative Backer.
Thank you, Mr. Chair. And Chair Marquardt, is this provision in your tax bill?
The member from Clay, Representative Marquardt.
Representative, thank you, Mr. Speaker. Representative Backer, would you repeat that, please? Which provision?
Representative Backer.
I'm sorry for that. Yeah, Mr. Chair, and then Chair Marquardt, I understand this provision, which would propose removing regions' ability to use the state revenues recapture program, was also in the tax bill. Am I correct or incorrect?
Yeah.
Representative Marquardt.
Mr. Speaker and Representative Backer, that is correct.
Representative Backer.
Would Chair Marquardt continue to yield?
Representative Marquardt, will you continue to yield?
Mr. Speaker, I will.
He will yield. Representative Backer.
Thank you, Mr. Speaker and Chair Marquardt. Then why would we need this to be traveling in two different locations, two different bills? Why would this have to be in the HHS bill?
Representative Marquardt.
Thank you very much, Mr. Speaker and Representative Backer. I mean, you have to talk to the Health and Human Service Chair to see why it is being carried in that bill. It is being carried in the tax bill. It's something we thought was good to be in there, but why it might be in another bill, you would have to ask another chair.
Representative Backer.
Thank you, Mr. Chair. Would Chair Liebling yield to a question?
Representative Liebling, will you yield to a question?
Yes, Mr. Speaker.
She will yield. Representative Backer.
Yes, Chair, you probably saw this coming, but my question is why, if this is in Chair Marquardt's bill, what was the reasoning on your behalf to also include that in this bill, please?
The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And Representative Backer, you know, often we have provisions traveling in different places in our bills. And until something passes and becomes law, there is no guarantee that it will happen. So often members put different provisions or the same provision in different places. This provision, however, is not really the same as what's in the tax bill. And I'm really grateful that Representative Marquardt did put it in the tax bill. But this one is the part of the bill that this is on is Regents Hospital is requesting an exemption from the bed moratorium, and they're asking for 45 new beds. And as you know, Regions is part of Health Partners, which is a very large organization. And we looked at the issue, and members believe that, yes, indeed, there is a need for the 45 additional beds. They have pledged that 20 of them will be mental health beds. And in fact, that was from the last time they got an exception to the bed moratorium. They had pledged some mental health beds, and so that is in the bill, that they're going to do the 20 mental health beds before they continue with the other beds they need. But we thought that it was appropriate, and I think Representative Ryer also would like to speak with this, and she is the author of the provision that's in the tax bill. But this is a provision that basically says, you know, just don't use our revenue recapture provision anymore. I mean, whether this goes through to the end in the tax bill or not, and it does have some costs in the tax bill, by the way, which kind of surprised me, but it does. But this is a provision that really there is no reason in my mind that a large, well-heeled organization like Health Partners needs to come to the state and use us as a collection agency. And what this revenue recapture really is, Representative Backer, and I don't know if you've had a chance to really understand this, but members need to know that this revenue recapture procedure means taking somebody's tax return, money that they think they're getting, and suddenly it's diverted, and not to pay back taxes or something like that, but to pay off medical debt at Regions Hospital. When Regions, no one is saying they shouldn't try to collect their medical debt. They can hire a credit company just like every other business does. They don't need to use the state any longer as a collector for them. And there are all kinds of other issues. And I hope that Representative Ryer will speak to this because she knows far more about it than I do. But that is why it is traveling here, Representative Backer. There is absolutely nothing that says that you don't put things in more than one place. It's a very common thing that we do in the legislature, especially when you really want to get something across the finish line.
Representative Backer.
Yeah, thank you, Madam Chair and Mr. Speaker. I'm very familiar with recapture, serving on an ambulance service, because unfortunately there are times that we provide care and we don't get billed for it. One of the things is Regions Hospital provided 56 million, uncompensated care. I'm very familiar with Regions. One of my very first runs that I had was a lineman, worked for Travers Electric and got electrocuted. And he lived. We took him down to Regions. I was in the back of the ambulance all the way down, took him to a local hospital, Wheaton, and then had to transfer him down there. So I know the importance of what Regions provides. And one of the things with recapturing revenue like this that individuals need to understand is if a hospital has to go into debt collection, that's going to hit their credit rating. I know hospitals work really hard of trying to get a minimum of, if it's $25, $30, $40 payment per month. And also individual members need to understand this program is not necessarily for or designed for people with a lower social economics. There are individuals that just don't want to pay a bill. They're middle class. They just don't want to pay a bill. And the hospitals, doesn't matter if it's for private or public, need an avenue to recapture it, not to hit a person's credit rating and so forth. So that's what revenue recapture really allows hospitals to do that. And again, the reasons I support this is with my experience I had with Regions, how Regions helped that one lineman many, many years ago. Plus now in 2018, our recent data, Region Hospital provides $56 million in charity care. And they have, if they are not able to also continue to do that, I'm concerned that charity care, some of it may go away. So I would ask for a yes vote on this, member.
The member from Dakota, Representative Ryer.
Sorry for the delay. And thank you, Mr. Speaker. Thank you, Representative Backer. I am interested to speak to this because I stand strongly in opposition to revenue recapture as used by private businesses and putting the state's power and authority behind their ability to get their bills paid. A couple of things that I would say. The people who are most affected by this are indeed not the most poor. There are people who are working. They're making just a bit too much money to get healthcare benefits from the state. And so they are incurring medical debt. They are not able to pay it, and in fact, probably are not meeting their other expenses in life because of just the low cost of wages in our society for many working people. So what happens is they look forward to getting this tax return. They're going to fix their roof. They're going to pay off their kids' school clothes. They're going to use it for something else that they've been saving up for, and then find it gone. without knowledge, without consent, and leaving them even more hard off than they were. To the point about damaging their credit, I just want to tell you that I have been in a position plenty of times earlier in my life, a single mom living paycheck to paycheck or no paycheck to paycheck. And I was in a position where I needed that money from my tax return, and I got it, and that was good. But I also wasn't in a position where I was worrying about my credit. If you are in a position where you are just getting by, you would rather have the agency to make your own decision about what you're going to do with your tax return. There's that piece, but then it also comes down to what is the role of government? Is it really the role of the state of Minnesota to put our authority behind having our Department of Revenue take these funds and hand them over to a private organization? I would argue that it is not. And I think that we need to say we're going to step out of that and let health partners and regions manage on their own, because I'm quite sure that they'll be able to make that up. In 2019, they took in about $3 million. It's a lot of money for the people it's being taken from. It's not a lot of money to regions and health partners. Thank you.
Further discussion. Representative New Brindley.
Thank you, Mr. Speaker. I just want to make the point really quickly. We're being made to believe that this is some absurd comment, or concept. The state actually uses this to collect unpaid premiums from insurer. This is not unprecedented. There is a strong partnership between the state and these private businesses that are hospitals. And when we talk about things like, people can choose to fix their roof or pay for school clothes, and instead this money is being taken without their consent. Well, it's being taken to pay their unpaid bills. It's not just randomly being taken from them. It is being taken to pay for their unpaid bills. And those bills should probably come before paying for a new roof. This is kind of a no-brainer, and I encourage support of the amendment.
The author of the amendment, Representative Backer.
Yeah, thank you, Mr. Speaker and members. Also, one of the things that I want to make sure members are aware of, the hospitals reach out to the individuals. It's not like they go, whoa, we can't get this money, and we're going to do the revenue recapture. They reach out, they reach out, they reach out. I know there's been times in my life that we were upside down. We weren't living paycheck to paycheck because we always had less money before the paycheck came. And what I appreciated during those times is being able to reach out to individuals that we owe the money to and set up a payment. Hospitals will take as little as $25 a month. So I just want to make sure members understand that this is not like, oh, they're not making payment, we're going to go after their taxes, their lottery winnings, or anything like that. They reach out and try to make those type of arrangements. And as I shared, when I was in that position, I rather have a minimum payment instead of hitting my credit. So that's one of the reasons why I would ask for a yes vote on this, members. Thank you.
Seeing no further discussion to the Backer A20 amendment, all those in favor of the amendment, please say aye.
Aye. Aye.
All those opposed, please say no.
No.
The motion does not prevail and the amendment is not adopted. I would like to remind the body of Section 1 of the Policy on Public Health and Safety that was passed by the Rules Committee, which states that masks must be properly fitted to fully cover the wearer's mouth and nose. Thank you, members. There is an amendment at the desk. The clerk will report the amendment.
Baker moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A19-1.
The member from Candy Ojai, Representative Baker.
Thank you, members. A19, actually, Mr. Chair, I'd like to temporarily withhold that amendment and take the next one.
There's an amendment at the desk. The clerk will report the amendment.
Baker moves to amend House File Number 2128, the third engrossment, as amended. The amendment is coded A82.
The member from Candy Ojai, Representative Baker.
Members, the second amendment that I'm bringing forward to you is actually much more refined and more narrowly scoped than the first one, so I wanted to explain that a little bit. But this is about mental health for children. And there isn't a member on the floor that has not told constituents in their districts that this is important to them. I know it's important to you. It's really important to me, and I want to just share with you that I really hope that Chair Liebling and other chairs and leadership on the DFL majority will accept this as a friendly amendment, because while this bill and this amendment may not be perfect, it is really important that we provide beds as quickly as we can for children and adolescents for this super important critical need that we need in Minnesota. One of the best parts of my time with Chair Fisher's committee this year was, I think, this bill that we really opened up the conversation deeply with NAMI, with stakeholders, with hospitals, with patients that went through this process of being in a hospital for behavioral health. And I just really thought that what we came out of there with was one of the best pieces of legislation that I've been a part of, because we actually found a way to help make mental health beds more accessible more quickly in Minnesota. And that's what this bill does. There's 126 hospitals in this bill that can actually move along a little quicker. My amendment, I'm trying to get one more added onto that. So I want to make it 127 hospitals. And in fact, the one that I'm asking for help with tonight, members, is a company called Prairie Care, who's got a large campus in Brooklyn Park. The founders are originally from the Wilmer area where I'm from. And they have been providing amazing service for children and adolescent care for a number of years. But that hospital early this year said, we want to add 30 more beds. And for some reason, that was not a part of this process going through this final Omnibus bill. And I have had a number of conversations with my friends on the other side of the aisle to say, this is really important because it's the only hospital right now that actually wants to add beds. They have the place to put them right now in their current facility in Brooklyn Park. They're actually going to boot out the administrative wing and put more rooms right there. And I have been to this campus, and it's an amazing place that they help a lot of kids and families. So members, tonight, before I kind of decide how we want to record our votes on this, I'm hoping we can take this to conference. I'm hoping that we can have a deeper conversation about this with my friend Chair Fisher and Chair Liebling and others to try to find a way to make sure that this important hospital is included in this conversation, because they're the first ones standing up to say we'll do it. This doesn't cost the state anything, members, but it's really important that we, I think, have a good conversation on the front end so that we can try to have a good collaborative way to find a way to get kids service more quickly, because the process normally takes well over a year to have a hospital be approved with the Department of Health. But with the good work of our Chair Fisher and others and Chair Liebling, this can happen quicker, and I'm asking for us to move this along. So I will request a green vote.
The member from Ramsey, Representative Fisher.
Thank you, Mr. Speaker, and thank you, Representative Baker, for the amendment. I know your commitment is very strong in making sure that we can build out a strong behavioral health system, because we all know that when we started, in committees that our behavioral health system does not really exist in this state. And we spent a lot of hard work in our committee trying to address this problem. As a matter of fact, one of my top priorities going into this session as the behavioral health chair was to address the crisis our state faces with the impending loss of maybe another 100 beds from another hospital that might be closing. And I know those things weigh very heavily on our minds. And today we know that the front door for most Minnesotans in crisis is coming in through the emergency room, through the emergency department at their local facility. And most of these facilities either don't have any of the behavioral health units or don't have enough. And we're trying to figure out how to make it happen. And so this is part of the reason we had the hearings out there. One of the things that we heard very strongly in the hearing where we talked about these provisions was from the Hospital Association. The Hospital Association had said right off the bat is that one of the big problems out there is that we don't have enough reimbursement rates happening out there. We need to increase that. And that's one of the things that we've got in our base bill is that we're talking about putting more money into this area, which is great. That starts helping address it. The other thing that we looked at was coming out very narrowly with this amendment that we had right here. And I know that when the Hospital Association talked about it, they specifically said at that point in time, Prairie Care is not going to fit in that model, or hospitals like Prairie Care. And I know that when NAMI spoke, they were saying the same thing, and the hospital does not apply. And in the hearing, as we wrapped up, I said, hospitals like Prairie Care are not going to qualify under here, but they do have the other options out there, whether it be the public interest review, or as Chair Liebling reminded me, they can also introduce a bill directly into the House or the Senate to have that done. The reason we have some of the important things on there were things that I picked up when I was taking a look at the public review process that was last done on Prairie Care. First of all, I want to say Prairie Care does a great job out there. They are outstanding what they do and how they approach the work out there. Some of the things though that was highlighted in here about the concerns that when we're giving out more opportunities is that facilities that don't have an emergency department are less routinely able to and less routinely required to stabilize patients consistent with federal requirements to provide emergency stabilization regardless of a patient's ability to pay. And that's why we've got the emergency department in there, is because that starts acting as a filter. Now, I will say Prairie Care has done a very good job. They have taken charity care, they take medical assistance, et cetera. But we've been making some changes in here where we're changing the reimbursement rates. So we create the opportunity where other other hospitals might come in who are for-profit hospitals and say, oh, I don't need an emergency room anymore. I can come in, open up, and I don't have to take charity care patients. I don't have to take these other requirements in there. And as a result, they can start ciphering off the profitable people and leave the unprofitable people, the charity care, to the other hospitals that have got the emergency department out there. And that's a concern out there. One of the things that some of these hospitals are not required to, most of the hospitals in our state are in a voluntary agreement with the Minnesota Attorney General to provide discounts to the uninsured. That's something important that we want to make sure our hospitals have. Prairie Care has not signed on the agreement, but they've done a great job of making sure that they're carrying out and doing that kind of work. The broad language that we're looking at inserting would say you're no longer required to do that. In other words, another hospital could come in, for-profit hospital could come in and decide they're not going to do charity care, they're not going to do some of these other things, and put hospitals like Prairie Care at a disadvantage. And it's important for us to keep some of these things in mind, is that the proposed amendment creates a strike zone that is way too large in terms of the working and discounts for the uninsured, and that's a concern to me. And where that becomes a concern to me is that over the years, I've worked very closely with youth who are in crisis, and I know the value that Prairie Care provides to youth in those type of situations. And I think that it's important as we're going forward is that as we're crafting our language, that we keep it tight so that we can make sure we've got accountability in there for our hospitals going forward. I know that there was a lot of work that's been done on these. I know that some people have been taking a look and are concerned that, geez, if I vote down this amendment, I'm voting against Prairie Care, but you're not. We're still able in conference committee to take additional language in and say craft it more finely and bring it in at that point in time. And I want to say to Representative Baker that you have my commitment that even though I'm not going to accept your amendment and ask for a red vote on it, that I'm committed to making sure that we can get more exact language in there, because if Prairie Care wants to come in, is let's call them out and give them an exemption in there like they've had in the past. We've got a review process that has been out there. We've got a hospital system that's doing a good job. They're willing to bring more beds onto the process, but it's important that we name it out and call it out specifically. We can do that in conference committee, and I'm committing to working on that to put that together. So I would say at this, I would encourage a red vote at this point in time, but also a commitment that we will continue working on this as we get to the next stop.
The member from Olmsted, Representative Liebling.
Well, thank you, Mr. Speaker. And I actually wasn't really going to speak on this. I think that Chair Fisher did an excellent job. And so since I have the floor, I just would emphasize what he said, which is that there are really two things going on here. We all recognize that we need more facilities for mental health and substance use disorder treatment in this state. There is absolutely no question about that. The real question is, how can we do this in the best way to make sure that we keep a balanced system and actually, over time, expand those resources? What is being asked for here is not what everybody else comes and asks for, an exemption. You just heard an amendment dealing with Regions Hospital. Regions wanted to build 45 new beds. They did not want to go through the public interest process because it is one that takes a long time. So they came and filed a bill and asked legislators to give them an exemption. And in this bill is an exemption for Regions Hospital, because we did understand that there is urgency and that they need those beds right away. And it's because of what's happening in the East Metro and so on. On the other hand, Prairie Care did not do that and has not done that. And instead, what they've done is come and asked us to basically open up the exemption, open up the loophole that we have created one in this bill to try to get more mental health beds, as Chair Fisher was explaining. But they've asked us to create a permanent exemption for them. And instead of coming and saying, give us, allow us to build 30 beds, or, here's how quickly we need to get started, or anything like that, they're saying, give us a permanent exemption forever. And I would like to note, too, that on 1.4 of this amendment, they're not just adding language that says you don't have to have an emergency room if you're serving children. They say an existing hospital that solely provides treatment. So in other words, they're creating a forever exemption for themselves in this amendment. And yet if a new provider wanted to come in, they would not be under this exception. So I think Chair Fisher did an excellent job, and I think that members should vote no on this amendment.
Further discussion to the amendment. Representative Frankie.
Thank you, Mr. Chair. Thank you, members. I rise in support of Baker's amendment. I've been getting these nightly updates. I just want to draw to members' attention on how critical the need for our youth and adolescent expansion of beds is. I'll just give you two nights, the last two nights, for an example. Tonight, Saturday, April 24th, just like every night this week, there again is no child psychiatric beds available in any Minnesota hospital for children needing inpatient psychiatric care. There are 6 Minnesota hospitals that offer child psychiatric care, are all full again. Tonight, there are just 2 adolescent psychiatric hospital beds available in the Twin Cities. All other metro adolescent psychiatric beds are occupied. There are a total of 3 adolescent beds open tonight in greater Minnesota, all in Thief River Falls. So only 5 beds total are available in the 12 Minnesota hospitals that offer adolescent psychiatric care. Now that's Saturday night, members. Let's go to last night. So last night, members, tonight, Sunday, April 25th, there are no child or adolescent psychiatric beds available in any Minnesota hospital for children needing inpatient psychiatric care. There are 6 Minnesota hospitals that offer child psychiatric care, are full tonight. There are 12 Minnesota hospitals that offer adolescent psychiatric care, are also full tonight. Prairie Care has received 8 phone calls from emergency departments seeking to refer a child or adolescent psychiatric patient so far just today. And that's all yesterday, members. So there's a need, and we need to address it. So whatever we can do, we hear about this over and over again, but going forward, coming out of this pandemic and the situations that all of our kids are going to be facing, we need to invest in our children and invest in these organizations that are going to give us the ability to take care of our children. Thank you, members.
Further discussion to the amendment. The author of the amendment, the member from Candy, Ojai, Representative Baker.
Thank you, members. And again, I think just going back a little bit more, when I started 7 years ago in this body, most members here don't really understand too. Back then, I had to go toe-to-toe with Governor Dayton because he wanted to close down the mental hospital out in Wilmer. The hospital is owned and operated by the state of Minnesota. It's called CABS Hospital, Children and Adolescent Hospital, Behavioral Health Hospital. It's an amazing facility that actually, through some bonding the last few years, we just reopened a brand new facility in Wilmer that will hold up to 16 beds. Now, right now, the census is only 5 or 6 because of staffing and because they're just kind of getting it open. They literally have been open less than a year. And they are a hospital that takes the most severe cases of children and adolescents that are, hurting themselves or hurting others. Severe cases. I am really proud to be a homeowner or in the home district of that hospital. And again, the employees are doing a great job. And what I learned through this process was you got to fight for these kids. You got to fight for these facilities, because if you don't, it isn't going to happen. And I heard tonight again, my dear friend Chair Fisher and Chair Liebling, they're saying the need is there. There's no doubt about that. And we've got one who's ready to go right now. If we get them open a year earlier, members, why wouldn't we do that? If an average stay for a child in a hospital is about 60 to 90 days, this is about 1,200 children that will get service a year earlier. Do you know how hard it is to find beds? Well, you do, because Representative Franke just mentioned it. Tonight, on Monday, there's the kids under the age of 12, there's 0 rooms tonight. There's 1 room open right now in the state of Minnesota for an adolescent child hospital care. Now, what's important is that I passed on the First Amendment because it was too broad. This one is not as broad. So members, when you hear something about emergency rooms and that should be a part of this, I narrowed this down so if you don't have an emergency room, then at least you got to take care of children exclusively. And that's what Prairie Care does here in this amendment. Other hospitals can do this if they have an ER room. All the 126 hospitals have also been waived or could be given this waiver. They could open up more hospital beds as much as they wanted to if they want to do this. But even before our bill started early in February, Prairie Care had committed to starting this process that would have normally taken about a year plus. And this came along, and all of a sudden they found themselves outside the loop. Now they have been found, they have gone through this process many times before. Prairie Care is a facility that right now has 71 beds. They started with about 25, 30 beds, went up to 51 beds, now they're up to 71 beds. So they have grown over time. But they see a need, there's a tremendous need here. And members, I I didn't want to force a vote on this, but it's that important that we need to do this. The House position is important, and it's important to the Senate. Do you care about this or not? This is really important. So I urge members today to dig deep and to say, for the kids, for the 30 beds, to a hospital that wants to do it right away, to a proven quality product per Chair Fisher. They do a good job. They're certainly licensed by the Department of Health. All those things, they fall into place. But why do we want to wait another year for this hospital? I don't think I can't rationalize it. These kids need help. And again, I went toe-to-toe with Governor Dayton. I was lucky. I won. And now we have a new hospital in Wilmer that would have closed it. It wasn't going to get reopened. It was just going to get closed up. And they would have had other companies like Prairie Care or like Regions or other places do the mental health for these kids. But with those level of care for the kids in Minnesota, for the state level that I have in Wilmer, those need really special care. So members, please, if you want to put your money where your mouth is, if you really want to expand hospital care for children in mental health, this is one to vote with me on. Mr. Speaker, I am going to ask for roll call on this.
Representative Baker requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Representative Baker.
So let's do this, members. Let's put your stamp on it. You have a chance right now not to wait to see who else might step forward, as was mentioned earlier. We have to do this, and now is the time to do it. We've got a hospital that's in the queue ready to go. But the current bill is not quite right. And I have really, short of begging to have this come through, and I know Representative Fisher is very committed to this. I know he would carry this forward, and I'm still asking him to do that. And I hope this kind of thing doesn't sway any of this. And I hope that we come out with a lot of green votes right now, because the House needs a strong vote on this important issue. So members, please vote green on allowing hospital beds to reopen quickly for mental health with kids. Thank you.
The member from Hennepin, Representative Hertaus.
Thank you, Mr. Speaker, and thank you, Representative Baker. Members, there seems to be absolute consensus that we need to do more with regard to mental health in this state. And in particular, I mentioned last month in some of my comments on the floor, my family's own need for a mental health bed for my granddaughter. And members, I'm validating the crisis that there is that has been exacerbated by COVID-19 and the increased amount of psychiatric problems and depression, especially with our young people, but even people of all ages. We had to go out of state. The most populous county in Minnesota, Hennepin County, in the metro area, not a single damn bed to be had. You have to go out of state to get help. Thank you, Representative Baker. Members, please vote green.
Further discussion to the amendment. The member from Ramsey, Representative Fisher.
Thank you, Mr. Speaker. And Representative Baker, I know where your heart is on this, that you really want to make sure that we get things done on it for the kids out there. And I'm the same way. I want to make sure we get things done so we can get the kids taken care of. But I just am not comfortable enough with the language that we've got on there. I'm afraid that it would end up helping create a parallel system out there. This does not mean that by voting no on this, that I'm going to stop working on this. By voting no on this, I mean, this is not the acceptable language, but I'm going to continue. I will commit to you to continue to work on this so that we can get the process done so that Prairie Care can get the additional beds out there with the right guidelines on it. And I would ask for a red vote. Thank you.
The member from Candy Ojai, the author of the amendment, Representative Baker.
Thank you, Mr. Speaker. And again, thank you, Chair Fisher. I guess I have a question then for the Chair. Chair Fisher.
Representative Fisher, will you yield to a question? He will yield. Representative Baker.
And thank you for your commitment. I'm having a hard time with the connection here. I brought you an amendment that's tighter than your current language, and your commitment is to work on this. What is stopping you, Chair Fisher, from taking this to conference, continuing to fight for the House position, and tweaking it as much as you need to make sure we get these beds open? Help me understand that disconnect, Chair Fisher, because I know you will fight hard for this. I expect that you'll be on the conference committee. I need your help. Why won't you at least take this to conference?
The member from Ramsey, Representative Fisher.
Thank you, Mr. Speaker, and Representative Banker. My concern is that it's not narrow enough. I'd feel much more comfortable, and this is going back to what some of the discussions that we had earlier, is making sure that we have the emergency department and everything else. I'm open to having something that was much more narrow, saying, for Prairie Care, X amount of beds that they would have to add at their current campus going forward. And the reason I want to make sure that it was much more narrow is because we also have needs throughout the entire state. And one of the things that I'm thinking of is we could still, if we don't have it narrow enough, another organization could come in and take advantage of this and say, we will continue to go forward, but we're going to do something else. We're not going to follow the same requirements, because as I read the amendment here, it was to take the provision off that would allow any adolescent. So you could have another adolescent hospital enter the state. And that is my concern, is making sure I wanted it narrower. And that is something that I communicated before to folks. I do know that when I first became aware of this was after our first meeting that we had that was on May 10th, is when I first got an email in that evening asking, how can Prairie Care get involved with this? And that was when I first started hearing about it. So while they may have been planning it earlier, it was not until later on that these things started coming to my attention.
Representative Baker.
And thank you, Chair Fisher. Again, and one final question, if you would yield, Mr. Chair, Mr. Speaker.
Representative Fisher, will you yield to a question? He will yield. Representative Baker.
So what's really kind of neat about this process, Chair Fisher, is that when you see my amendment come up, and you like a lot of the amendment, you do an amendment to the amendment. Was there a reason why that was not presented to us today to try to make it tighter that you want to do, which I believe you wholeheartedly? I'm wondering if there's a way, and if there was a reason why you chose not to do an amendment to the amendment.
Representative Fisher.
Thank you, Representative Baker. Because I was struggling trying to figure out the best way to put the amendment together, to be very honest. It was because it's a complicated process. It's because initially when I was thinking about it, I was still thinking too broad, is trying to figure out. It wasn't until more recently, it's like, name the hospital, name the beds, name everything along those lines. And that's the thing that I've struggled throughout the process. And part of it would have helped if we would have had a bill with the specifics in front of us much earlier on that we could have had, like with regions. When the questions first came up to me back in March, the things could have been started drafting at that point in time, and that would have been a lot more helpful because we would have had more of those details, and we probably would have not been in the situation that we are today.
Representative Baker.
And thank you, Chair Fisher, for that. Again, if there was an opportunity for you to accept this amendment, we would withhold the roll call. You know that I'm open to that right now. This is so important that we need to know where members are at on this issue. And I think this is something that I really urge members to vote green on my amendment. By voting green on the amendment, we are supporting children that need mental health. And if we can somehow quickly convince our majority friends to do this without a roll call, we can do that. But if that's the case, let's do it, because this is important to me. And Mr. Speaker, thank you for allowing this extra conversation on this. Let's do something good for the kids tonight for mental health. We've all said it. We all want to do it. We've got a hospital that wants to move on this. Members, please vote green.
Seeing no further discussion to the Baker A82 Amendment, the clerk will take the roll. Members who are voting remotely, please vote. Will the chief clerk call the names of the members who have not voted yet?
Dabney.
Gotten movement out of her in the last few days. So, yeah, that's going to help.
Dabney votes no.
Dabney, no. Hanson, R.
Hanson, R, no.
Hanson, R, no. Hassan.
No.
Hassan, no. Houseman.
Hausman, no.
Houseman, no. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, aye.
McDonald, aye. Moeller. Moeller. Nash.
Nash, aye.
Nash, aye. Pearson. Pearson, aye. Stevenson.
No.
Stevenson,
no.
Stevenson, no. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson.
Thompson, no.
Thompson, no.
The clerk will close the roll. There being 63 ayes and 68 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Franzen moves to amend House File Number 2128, the third engrossment as follows. The amendment is coded A57-1.
The member from Douglas, Representative Franzen.
Thank you, members, and thank you, Mr. Speaker. So the A57 Amendment, members, most of you probably know that I have been looking at the COVID deaths since last December, and so this amendment deals with that. I would require the state register to conduct an audit of all deaths attributed to COVID to determine whether COVID actually caused the death. Did people die of COVID or die with COVID? This is an important question that we should answer as we look back at the decisions made the last year. Thank you.
There's an amendment to the amendment. The clerk will report the amendment to the amendment.
Freiburg moves to amend the Franzen Amendment to House File Number 2128, the third engrossment as amended. The amendment to the amendment is coded A117.
The member from Hennepin, Representative Freiburg.
Thank you, Mr. Speaker. Thank you, Representative Franzen, for the amendment. I guess I don't see why the review mentioned in the amendment should be so narrowly focused on one aspect of the pandemic. So the secondary amendment would allow the commissioner to review all measures that were taken to prevent and control the spread of COVID-19. And I would encourage members' support for this secondary amendment.
Further discussion to the amendment to the amendment. Seeing none, all those in favor?
Mr. Chair.
Representative Franzen.
Thank you. So the Freiburg Amendment would require MDH to review all the measures taken by the state to control COVID in the last year. I agree, members. We should know whether the governor's forced lockdowns and business shutdowns helped. We should also know whether these actions caused more suffering to Minnesotans or whether they actually helped prevent the spread of COVID. Members, I don't understand why this has to be an either or choice. We should want to know whether the state's COVID numbers are accurate. I have in front of me the 2021 death files, going through January to March 17th of 2021. And I can tell you, there are at least 10 that have been coded with the UCOD of the U701, which is the the coding that is used for classifying deaths as COVID. And I'll just read a couple of them. And first it says, other contributing factors for a person, this person here: primary biliary cirrhosis, esophageal varices, portal hypertension, right-sided heart failure, recent pulmonary embolism, obesity. Then you work your way backwards. So primary biliary cirrhosis, severe pulmonary hypertension, severe tricuspid regurgitation, cardiopulmonary arrest. And then members, that is classified as a COVID death. Let's see here. Other contributing factors for this person: COPD. Scroll. Let's see. CHF, I don't know what that is. CKD stage 4, severe tricuspid insufficiency. But guess what? That is listed as a COVID death. We have here atrial fibrillation, tricuspid regurgitation, mitral regurgitation, fall with lumbar spine compression fractures. Work your way backwards here. Right ventricular heart failure, which led to the acute renal failure, which led to aspiration, and then respiratory failure. Guess what? COVID death. I also have in one of the files here, see if I can quickly bring it up. I know time is super important. But there is actually a suicide here that is coded as a COVID death. Yep, here it is. So scrolling here, the injury here: presumed intentional drug toxicity, hospital admissions, specimens for available for confirmatory testing. But yes, so this one was also coded as COVID, but it was a suicide. So members, clearly, I am not asking for anything out of the realm here. We should want to know also, on top of that, whether the governor's actions in the last year served any benefit. And so I don't oppose knowing everything that happened in the last year, but it seems my friends across the aisle might not actually want to dig into the data. You know, Florida did a investigated their COVID deaths, and it looked like that had been exaggerated by 40%. Washington State dug into some of it. This is not something crazy I'm asking for. I just got off the phone with a person from Todd County area and has been following this area or this issue very closely, and his brother-in-law just passed away and is worried that his brother is going to be listed as a COVID death when he had cancer. Members, because Representative Liebling's amendment deletes the audit of deaths to make sure that the COVID statistics are accurate, I'm going to request that members vote no on the Liebling amendment.
The member from Wright, Representative Lucero.
Thank you, Mr. Speaker. And would the author of the amendment yield for a question?
He will yield. Representative Lucero.
Thank you, Mr. Speaker, and thank you, Chair Freiberg. I am actually, I don't know if you are a chair. I take that back if you're not, Representative Freiberg. I am looking at your amendment to the amendment, and one of the more difficult to try to review on the fly here are the page and line amendments, which this one is. And I see several instances of the words shall being deleted and inserted may multiple times throughout this. And it's difficult to do that line and word on the fly. And so I'm wondering if you can confirm my understanding that you are deleting that the commissioner shall and must perform this audit and inserting may.
The member from Hennepin, Representative Freiburg.
Thank you, Mr. Speaker. Thank you, Representative Lucero, for the question. Yes, that is correct. This amendment would make the review a permissive one. So I appreciate the opportunity to clarify that, because I believe Representative Franson said at the outset that it would be required. But Department of Health resources are strained at the moment because of the pandemic. We don't want to place additional mandates on them. And also, there might be a cost to making it mandatory as well. So this avoids that problem.
Representative Lucero.
Thank you, Mr. Speaker, and thank you, Representative Freiberg. Okay, well, going from a shall to a may, that effectively means nothing, right? If it's permissive, they can do it now, is my understanding. Actually, let me confirm that. Would he yield for another question?
He will yield. Representative Lucero.
Thank you, Mr. Speaker, and Representative Freiberg. If this amendment were not even offered, and if the amendment to the amendment and the amendment were not even offered at all, would that change anything? And could the commissioner still, under their existing authority, quote unquote, may perform this review?
Representative Freiberg.
Thank you, Mr. Speaker. Thank you, Representative Lucero. Yes, that is correct, but the legislature does frequently state its intention and the goals it would like to see there, so I believe it is helpful to have in law some sort of explicit authorization from the legislature expressing its approval that the commissioner may undertake that action. It certainly is better than a prohibition on such a review.
Representative Lucero.
Thank you, Mr. Speaker. Well, and thank you for confirming that this amendment, or that your amendment to the amendment essentially accomplishes the status quo, that this is not needed because this is present law. We don't need to, we're not changing anything. They can perform this. We know they won't perform it. And so Representative Franzen's amendment is trying to get to the fact that they won't perform it to they shall perform it. And the amendment to the amendment essentially guts that and puts it back to they won't perform it. And under the costs, we just had a conversation earlier this evening on this very bill that the majority wasn't concerned about the $150,000 additional cost it was going to create. So if the majority party doesn't have an interest in where the agency is going to find $150,000, why is there a hallelujah, a moment all of a sudden where they care about where they're going to get the money? So we need to leave it as a shall. We should absolutely, in my opinion, vote against the Freiburg amendment to the amendment because it guts it and it's meaningless. Thank you, Mr. Speaker.
The member from Candy Ojai, Representative Miller.
Thank you, Mr. Speaker. And Representative Franson, thank you for this amendment. This is the question that people are asking, and this is not a complicated thing to do. We know the deaths, and we should be able to, if you will, audit what the causes were. And when you see an amendment to an amendment like this, members that have been around for a while, we've seen this. This is an amendment to the amendment to just basically gut an amendment that they don't want to vote on. And I don't get it. I don't understand. This is information that's important for policy moving forward. This is information that's important to the people. There are suspicions out there that are causing people to question their own government. Members, this is an opportunity for us to clarify some of this. It reeks of we're trying to hide something. It reeks of like there's an ulterior motive in this. I don't understand why something like this wasn't part of the original bill, much less having to come forward as an amendment. So Representative Franson, thank you for your willingness to ask the important questions. I'm disappointed in the amendment to the amendment. Members, please vote no to the amendment to the amendment and vote yes for Representative Franson's clean amendment. Thank you.
Further discussion to the amendment to the amendment. To the author.
Mr. Speaker, I request a roll call.
Representative Franson requests a roll call vote. Seeing 15 hands, there will be a roll call vote. To the author of the amendment to the amendment, the member from Hennepin, Representative Freiberg.
Thank you, Mr. Speaker. I appreciate that. Thank you for the discussion about this amendment. I would just point out, I appreciated the information that Representative Franson provided. I guess I would point out that under this amendment, investigation of all of those are still authorized under this amendment. So I would encourage members to vote yes on this secondary amendment. Thank you, Mr. Speaker.
Seeing no further discussion, the clerk will take the roll. Members who are voting remotely, please vote. Will the clerk please call the names of all the members who have not voted yet?
Frankie. Frankie, no. Hanson R.
Hanson R. Aye.
Hanson R. Aye. Hausman.
Hausman, aye.
Hausman, aye. Mariani.
Mariani, aye.
Mariani, aye. McDonald.
McDonald, no.
McDonald, no. Nash.
Nash, no.
Nash, no. Pinto. Pinto, aye. Stevenson. Stevenson. Swazinski.
Stevenson, aye.
Stevenson,
Swazinski, no.
aye. Swazinski.
Swazinski, no.
Swazinski, no. Thompson.
Thompson, aye.
Thompson, aye. Erdahl.
Erdahl, no.
Erdahl, no.
The clerk will close the roll. There being 70 ayes and 62 nays, the motion prevails and the amendment to the amendment is adopted. To the underlying A57 Franson Amendment.
Mediation, Minnesota, as well as a representative.
To the author of the amendment, Representative Franson.
Thank you, Mr. Speaker and members. Well, that's disappointing. Totally gutted the bill. I don't exactly know what you are afraid of. Minnesotans deserve the truth. And if you are so confident in this government, in the Department of the Department of Health, then you should gladly welcome putting my accusations to rest. You know, I'm not going to stop. I'm going to keep exposing what I'm finding, and it's shameful that you want to hide and not allow for the real truth to come out. As far as the comment of MDH being strained, I find that extremely laughable. MDH is throwing money left and right under the guise of COVID. I'm pretty sure that they could scrap up a couple of dollars and have done the audit of the death files. But perhaps you're just scared. You're scared of what is really out there, and that you are afraid that Minnesotans would really find out that the deaths were inflated. In fact, that you have been psychologically abusing its people, and you just don't want them to find out about it. But you know what? I do want to know answers as well on whether the restrictive actions taken by Governor Walz in the last year helped or hurt. Let's find out if shutting down Main Street across the state while big box stores like Target and Walmart were allowed to profit while our small businesses were closed. Let's find out about how that mysterious COVID modeling, whether it was accurate or led to more harmful actions taken by Governor Walz. I'm pretty sure I have a good, clear answer of that, but let's do this little amendment or adopt this bill. I think we want answers. I want answers, and Minnesota deserves answers. So members, I would request a yes vote.
The member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker. And, you know, members, usually I don't engage in this, answering this conspiracy theory stuff, but I'm getting a little tired of this accusation about being afraid of things and we don't respond because it doesn't bear responding to, Representative Franson. That's why we don't respond. You know, previously on an amendment, Representative Franson, you were completely contradicting yourself. On the one hand, you want to say that the deaths really aren't from COVID. And then on the other hand, you want to say that, oh my gosh, nursing home deaths are just over the top and are somehow being caused by policies from the administration. You know, and then you just now went off the rails talking about other aspects of this that you don't like. I just want Minnesotans to know that our Department of Health has done a very good job. And when you look at how we've done in terms of cases and deaths and keeping this thing under control, we've done a lot better than a lot of places. And anybody right now who's watching the news could see what's happening in India. You know, this is a serious issue, Representative Franson. This should not be all about conspiracy theories. And, you know, my husband happens to be a retired physician. He's watching, and he's—
Mr. Speaker.
All those things are comorbidities.
Point of order.
Representative Davids, for what purpose do you rise?
Point of order.
State your point of order.
Representative Liebling is questioning members' intentions, saying that they have conspiracy theories and et cetera. I'm not aware of the conspiracy theories. I wish she would confine her language to the amendment at hand.
I will remind members that under Mason's section 124, it is not the person but the measure that is the subject of debate, and it is not allowable to arraign the motives of a member. Representative Liebling.
Well, thank you, Mr. Speaker, and I'm just about done. I don't want to belabor this, but I just thought it really had to be answered. And every time I say anything, the thin-skinned Republican Party members jump out of
Mr. Speaker.
I'm done.
Point of order.
Representative Davids, for what purpose do you rise?
Section 124, questioning motives of members, calling members on the other side of the aisle thin-skinned. Obviously, I'm not thin-skinned. Thank you, Mr. Speaker.
Representative Liebling.
Well, thank you, Mr. Speaker. And Representative Davids, you are always a good-humored person, at least usually. And, you know, I've said for many years that what happens to us around here in the legislature is that we don't really gain weight, we just get thicker skins. But apparently some members don't get a thick skin, but they can sure dish it out. But thank you, Mr. Speaker.
The member from Wright, Representative Lucero.
Thank you, Mr. Speaker. I appreciate following that exchange. I love the good humor around here every once in a while. To the point of rising here, I find it incredibly laughable that the comments from Chair Liebling are to the effect of calling Representative Franson flip-floppy or hypocrite or going, you know, saying one thing to another. That's what we've seen over and over last week. Repeatedly, this majority with their relativism, and if it has a D after it, voting for it, if it has an R after it, voting against it, and just this evening, it had a D after it, so they voted to completely ignore the
point of order, Mr.
$150,000.
Speaker.
Representative Winkler, state your point of order.
Mr. Speaker, members must confine their remarks to the issue before the body, and that is this amendment. Representative Lucero is out of order.
Again, I will remind members that under Mason's 124 is not the person but the measure that is the subject of debate, and it is not allowable to arraign the motives of a member. Representative Lucero.
Thank you, Mr. Speaker. Tell the majority leader to sit down because I wasn't speaking of any personality or anything else. I was speaking about this bill. We have seen members change direction depending on who's making motions and who's authoring bills. Just this evening, we saw that with $150,000. Members, I'm just amazed at the hypocrisy of this majority. Thank you.
The member from Candy, Ojai, Representative Miller.
Thank you, Mr. Speaker. And I want to thank Representative Davids for stepping up. I noted the word conspiracy as well. Chair Liebling and members, this is a question that a lot of people are asking. I get this question all the time. And there does seem to be a pattern this year that anytime someone is asking some challenging question against the governor or some challenging question against the powers that be in very tense and strenuous times, particularly from our side of the aisle, we hear words like conspiracy. We hear attacking words that are effectively meant to quiet us down, shut us up. There's people in my district, this is a legitimate question. This was not some sort of fanciful question to try and point out something. This is a very straightforward question that Representative Franson's amendment was going to address. We have deaths. How many are deaths directly caused by COVID? How many were deaths with someone with COVID? There wasn't any sort of, how is the government trying to cover it up? There wasn't anything like, what does this mean that we're trying to do in the future, or anything like that. This was a simple question that's been derived into all sorts of things, including just because Representative Franson didn't pose her statements in a way that was acceptable to the chair, she felt the need to come forward and start insulting Representative Franson. And I don't understand it. This just didn't make any sense. We can do better than that, members. I'm disappointed that the amendment was watered down, but there's the votes to do that. I say that we support what it is that Representative Franson wants, but more important, represent what the people of the state want. They want information. They want to know what is going on here. Thank you, members.
The member from Sibley, Representative Gruenhagen.
Oh, thank you, Mr. Speaker. Yeah, I had two of my constituents contact me this past year and asked me what is going on. They knew what their grandparent passed away from, and yet the death certificate actually said COVID. So they were very concerned about the misrepresentation on the death certificate being primary COVID when they knew it was another reason. Mr. Speaker, if Representative Franson would yield for a quick question.
Representative Franson, will you yield for a question?
Yes.
She will yield. Representative Gruenhagen.
Oh, thank you, Mr. Speaker. Yeah, Representative Franson, you did a YouTube with former state senator and Dr. Scott Jensen. If I remember right, you looked at approximately 2,800 death certificates, and close to 40% of them were mislabeled as far as the death certificate. Is that correct?
The member from Douglas, Representative Franson.
Thank you, Mr. Speaker. Representative Gruenhagen, yes, to my recollection, that is what we had estimated, and that is why I requested that we have an audit done.
The member from Sibley, Representative Gruenhagen.
Well, I just wanted to bring out, it's just not Representative Franson's opinion. There is credible evidence behind it, and even Dr. Scott Jensen, if you can find the YouTube on there, where Representative Franson and former state senator Dr. Scott Johnson put forward the evidence as far as the misrepresentation on the death certificate.
Jensen, not Johnson.
Correct it.
Representative Gruenhagen, please
Scott
continue.
Jensen.
The member from Douglas, Representative Franson.
Thank you. Mr. Speaker. Members, so as we were just going around this whole, whatever you want to call it here, I just want to remind you that the Senate had a hearing today with Minnesota Department of Health, where we found out through emails that MDH invented restrictions based on invented info from political consultants who shut down youth sports because of politics, not because of science. Clearly using political science to gauge the dials turning up, turning down, along with the so-called pause. Let's see here. Here's an email. The subject is called Data on What's Driving the Spread. This was shared at the Senate hearing today from a data practice request, okay? COS has been asking for data to be given to the governor regularly, in quotations, I propose weekly, on what is driving the case increases. We need some way to estimate total impact from generations of transmissions, not just the primary cases. People look at primary cases and think those are small impacts that don't justify the dial backs we propose. Are you kidding me? See right there, here's another one. Oh, this is regarding, the governor is wanting long-term care to be thinking about proactive and aggressive as long-term care deaths going back up. Sounds like Commissioner and Aaron are tracking some data to pull. But for some messaging notes as you think about coming days, how do we compare to other states, blah, blah, blah. And then as people push back on youth sports, whether they really needed to be ended, it says this. This is what it says in this email. We need to do more, we need to more explicitly tie youth sports to long-term care. People are going to youth sports, sitting in bleachers, eating popcorn and eating popcorn. Can you imagine the horror? Eating popcorn and talking with people around them, cheering. I suppose having fun these days is illegal. Then maybe stopping at a restaurant or a bar on the way home. Then going to jobs in long-term care the following day. The spread in deaths in long-term care can be tracked to youth sports in some of these social settings. But don't tell me we don't need an audit. Minnesotans deserve answers, and the students of our state, the children of our state deserve answers, and every unemployed person deserves answers as well. This is absolutely ridiculous.
The member from Hennepin, Representative Freiburg.
Thank you, Mr. Speaker. The item before us is the modified amendment, which would allow MDH to conduct a review of measures related to COVID, and I encourage members to vote yes.
Seeing no further discussion, all those in favor of the amendment as amended, please say aye. Aye.
Aye.
All those opposed, please say no.
No.
The motion prevails and the amendment as amended is adopted. There is an amendment at the desk. The clerk will report the amendment.
Damath moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A45-1.
The member from Stearns, Representative Damath.
Thank you, Mr. Speaker. Mr. Speaker and members, the A45 is an amendment that will address an area and an issue that is of great concern. During the Select Committee on Racial Justice, as we met last fall, we heard about the many of the health disparities and the issues that are facing our communities of color. In the final report of the committee, one of the recommendations was to support recruitment and employment of healthcare providers from communities of color. Unfortunately, this omnibus bill does not take action on this recommendation, so I have an amendment that would fix that oversight. The amendment expands the state's loan forgiveness program for healthcare workers. We would provide $5 million in both FY 2022 and FY 2023 for health professionals from underrepresented communities. This will help the state attract, recruit, and keep employed healthcare workers who will make healthcare work more diverse. The funding is going to be taken from DHS's operating adjustment. We think that it is much more important that we, as a state, move forward on improving the diversity of our healthcare industry rather than growing our government. So with that, Mr. Speaker, I would request a roll call.
Representative Damath requests a roll call vote. Seeing 15 hands, there will be a roll call vote. Representative Damath. All right, the member from Olmsted, Representative Liebling.
Thank you, Mr. Speaker and members. And Representative Dameth, the idea is certainly not a bad one. You know, you can't do everything in every bill. And this bill already does a lot for people in underrepresented communities. The dental care provisions, a lot of the medical assistance provisions, Representative Vang's bill for expanding diversity in our mental health workforce. There's just so much good in this bill. And so while I have to recommend a no vote because of the cost of this, I certainly will look forward to seeing you vote yes on the omnibus bill because it is right up your alley. And I do appreciate that you were a really good member in committee, and I know you're very serious about some of these issues and look forward to continuing to work with you, but ask members to vote no.
Further discussion to the amendment. The member from Stearns, Representative Dameth.
Thank you, Mr. Speaker, and I appreciate the encouragement and the comments from Chair Liebling and looking forward to working. But what I can tell you is we do know that better health outcomes happen when we have healthcare providers and healthcare workers that look like us. We know that. We have data to prove that. And so rather than making our Minnesotans wait for what they need, I would encourage a green vote on this amendment so we can get this action into place and we can help our Minnesotans get the health outcomes that they need. And I would encourage a green vote.
Seeing no further discussion to the A45 amendment, the clerk will take the roll.
What are we voting on?
Members who are voting remotely, please vote.
You guys got me. Are you leaving, Andrew? Sorry to see you go. No,
Will the clerk please call the names of all those members who have not voted yet?
Backer votes aye.
Backer, aye. Hanson, R.
Hanson, R, no.
Hanson, R, no. Hausman.
Hausman, no.
Hausman, no. Kreshaw.
Grisha, aye.
Kreshaw, aye. Mason.
Mason, no.
Mason, no. McDonald.
McDonald, aye.
McDonald, aye. Miller. Miller. Nash.
Nash, aye.
Nash, aye. Stevenson.
Stevenson, no.
Stevenson, no. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson.
Thompson, no.
Thompson, no. Erdahl.
Erdahl, aye.
Erdahl, aye. Miller. Miller, aye.
The clerk will close the roll. There being 60 ayes and 72 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Dameth moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A94.
The member from Stearns, Representative Dameth.
Thank you, Mr. Chair. The A94 is an important amendment, and I am excited to tell you a little bit more about that. We know that the A94 amendment would ensure that the more than $300 million in federal child care stabilization funds are used as intended, which is to stabilize the child care provider market. The bedrock of that industry and service are the private family child care providers and child care centers found in our communities across the state.
Right.
As the bill is currently drafted, these funds would be directed toward public programs already accessing other federal relief funds. While school-based early learning programs provide a valuable service, they are not threatened to the same extent that our private family providers and center-based providers are. These private providers have stepped up to meet the needs of our essential workers. While school closures also included shuttering our school-based preschool programs, the private family child care and center-based child care providers continue to serve our communities. With that, I would ask members that you would support the A94 amendment to make sure that these federal funds go to the providers that are most in need. And Mr. Speaker, I would request a roll call.
Representative Demuth requests a roll call vote. Are there 15 hands? Seeing 15 hands, there will be a roll call vote. To the member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. And Representative Demuth, thank you for allowing, for shining this light on this really exciting part of the bill. So as Representative Demuth noted, the bill contains a continuation of some monthly payments that have been going to keep our early learning and care sector in operation during the pandemic. We were actually the first state to take this step. We put in place the peacetime emergency grants back in March of 2020. Those then transitioned into public health support grants that receive federal funding. And now under this bill, we will continue providing this support to make sure to address the economics at the heart of this sector. Here's the challenge, though, with the amendment, Representative Demuth and members, is that those public health supports have been going quite a bit, in fact, almost entirely to private providers, but there are some public providers in there that we would want to make sure continue to receive funding. So most Head Starts, for example, are nonprofits, but there is one that's operated in the Duluth public schools from out of that area. We have university-based child cares. Winona State University is one, and University of Minnesota, and many others. There are some school-based programs, such as there's a program in Albert Lee, and some school-age care programs as well. And we would want to make sure that simply those payments that have been being received through the months will continue to. But here's the fundamental problem with this proposal, members, is that it would violate the federal law that these funds have been received under. The federal law is very clear, I have it in my hand here, that defines eligible provider as a series of providers that are licensed and certified, et cetera, and those do include public providers. And so if they were to be excluded, that would be a violation of the language that's in here about the providers that need to receive it. So again, members, the public health grants have been going, the vast, vast majority to private providers and will continue to, but we do want to make sure that those public providers that I mentioned, relatively few in number, can continue to receive the funding, and that we, of course, can have this federal funding go out to keep this critical sector in position. So I'd ask members that you vote against the Demuth Amendment. Thank you.
Further discussion to the A94 amendment. To the author of the amendment, the member from Stearns, Representative Demuth.
Thank you, Mr. Speaker, and I appreciate the work that we have done together, Chair Pinto, and we continue to work. But members, I still do encourage a green vote. We know that the bill would send the federal relief funds to Minneapolis and St. Paul public school early education programs at the expense, actually, of Greater Minnesota. The bill would have our private family child care providers and child care centers across the state competing with Minneapolis and St. Paul public school programs. And you can lay odds on who would actually win this. And if I can use this analogy, it would be a battle such as David and Goliath. But in this case, it's not going to be David that wins this one. The American Rescue Plan is sending nearly $1.3 billion in federal funds to Minnesota public schools, with the Minneapolis and St. Paul schools expected to receive more than $366 million in federal funds. By comparison, the child care stabilization funds in this bill total only $325 million. That means the Minneapolis and public school systems would receive at least $41 million more than the entire allocation of the child care stabilization grants to support child care providers across the entire state. This bill would siphon funds from the stabilization grants to public programs already being supported with more than $1 billion of federal funds. We know throughout the pandemic that our child care centers and our family child care providers have been elevated to that essential work. We can't do our work if we don't have safe places for our kids. So members, I would ask that you would adopt the A94, so these child care stabilization grants that would benefit family child care and child care centers could be available. And with that, again, I would encourage a green vote.
Seeing no further discussion to the A94 amendment, the clerk will take the roll.
Yep, I got it.
Members who are voting remotely, please vote.
Andrew, that was quick. You're back. I told you. You're like stealth. Ninja stealth. I didn't even see it. Oh, yeah. You don't want to miss out on the action.
Will the clerk please call the names of all the members who have not voted yet?
The next one's probably going to be really
Backer.
Backer, aye.
Backer, aye. Hanson, R.
Hanson, R, no.
Hanson, R, no. Hausman.
Hausman, no.
Hausman, no. Kreshaw.
Grisha, aye.
Kreshaw, aye. McDonald.
McDonald, aye.
McDonald, aye. Nash.
Nash, aye.
Nash, aye. Sandsted.
Sandsted, no.
Sandsted, no. Stevenson.
Stevenson, no.
Stevenson, no. Swazinski.
Swazinski, aye.
Swazinski, aye. Thompson.
Thompson, no. Swazinski, aye.
Thompson.
Thompson, no.
Thompson, no. Erdahl.
Erdahl, aye.
Erdahl, aye.
The clerk will close the roll. There being 62 ayes and 70 nays, the motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Franzen moves to amend House File Number 2128, the third and gross one as amended. The amendment is coded A80.
To the author of the amendment, the member from Douglas, Representative Franzen.
Thank you, Mr. Speaker and members. So the A80, this amendment requires child care providers seeing an increase in their CCAP reimbursement rates to be notified the rate increase is due to a temporary increase in federal funds. Using federal funds to increase provider rates sounds like a good idea, but the main concern is if the federal funds are unable to sustain the increase in the long term, then providers need to be prepared for a possible reduction in rates. Holding a future legislature hostage to general fund spending that is not even funded with general funds today is simply bad fiscal policy. Without any guarantee that these future funds will be available to cover these costs, we would be setting up a future legislature to be the bad guys so you can look like a hero today. You are literally writing a check you don't know that can be cashed. So I am asking for your support on the A80 amendment.
The member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Members, I want to build on what Representative Damon said before, that we really have had a good interaction in the Early Childhood Committee, and in particular with Lead Franson. I've appreciated her expertise and collaboration. And members, I especially appreciate the opportunity to shine a light on this aspect of the bill as well. Let's be clear, rates to pay for early learning and care for our low-income families right now are very, very low. When I tell legislators around the country where they're set at the 25th percentile of our market rates, their jaws drop. They cannot believe that our state would be doing that. What this bill does is increase rates to the 50th percentile, basically the median. One would hope we would do that for our young kids. And members, I guess I'm certainly going to urge a no vote on this. And I guess, members, I'd just like to ask Why is it that we think of early learning and care as being different from learning and care for older kids? Why don't we have the expectation when it comes to this that we're actually going to follow through and make sure that all kids can get off to a great start? Research says that the youngest kids, that's the biggest impact, and we know that parents need the support. They've got the lowest wages of their lives, they've got the most stress of their lives. And members, I guess when I think about this proposal to have a notice to providers to say, hey, your rates might go back down, you might have the rug yanked out from under you, it makes me wonder, well, do we do this for schools? Do we have a sign over the schoolhouse door that says, hey kids, when you walk in, don't get too used to that music class or that art class, because we might be pulling that away. Or if you go to a park, hey, just to warn you, State Park, it might be open today, we might be closing it tomorrow. Maybe, in fact, we do need some of that. Or when you drive over a bridge, to say, hey, we might be spending the money to keep this bridge up or we might not. Members, this is infrastructure. This is critical infrastructure for our state. So members, let's stick with it. Let's at least pay the people who are receiving poverty wages, who are not sure where their next meal is going to come from. Let's at least make sure to do right by them and have rates stay at the median. This bill has a permanent rate increase. Let's stick with it. And with respect, I would urge a no vote. Thank you.
Further discussion. The member from Douglas, the author of the amendment, Representative Franson.
Thank you, Mr. Speaker. And as Representative Pinto did say, we have a wonderful relationship. I consider Representative Pinto a friend of mine. But I am going to request you all support the A80 amendment. You know, we do not know what the future holds as far as the economy. You know, inflation is going to be getting a little sky high because the federal government is just printing money like nobody's business, and the cost of goods are going up, and we are being propped up. The state is being propped up by federal funds, and that's going to end up stopping one of these days. So I just want to make sure that we are doing our part to not set up this legislature to be the bad guys in case things go sour with the budget. Thank you.
Seeing no further discussion, all those in favor of the A80 amendment, please say aye.
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 All those opposed, please say no.
No.
The motion does not prevail and the amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Novotny moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A97.
The member from Sherburne, Representative Novotny.
Thank you, Mr. Speaker. I also have an amendment to my amendment. I'd like to take that up now.
There is an amendment to the amendment at the desk. The clerk will report the amendment to the amendment.
Novotny moves to amend his amendment to House File Number 2128, the third engrossment as amended. The amendment to the amendment is coded A98-1.
To the author of the amendment to the amendment, the member from Sherburne, Representative Novotny.
Thank you, Mr. Speaker. The amendment to the amendment takes $500,000 out of the DHS fund and puts it into the MSRB fund. That $500 would be used to the Towards Zero Death program. That's the main bill. The amendment is a requirement that political subdivisions that cooperate with the activities of the Towards Zero Death program to reduce the deaths in the state must allow the State Patrol to utilize any facilities of that political subdivision. Mr. Speaker, the members of the State Patrol do a tremendous job every day across the state of Minnesota. They serve us, they protect us, they enforce the laws that we pass. In recent weeks, they've been among the front lines protecting Minnesotans from civil discourse. Last week, however, the Minneapolis Park Board passed a resolution that kicked the state troopers out of a facility that they had at the Park Police. Now, they need a place to stop. They need a place that they can securely download, charge their batteries, and take care of biological needs. They need to do this, and you got to understand that this toward zero death, it's an overtime shift. You're going to have someone coming from an area, maybe from the St. Cloud district, coming down to work this extra shift. They need some place that they can go, and that is what this bill is for. If the city is going to accept the extra security, they should at least allow that the troopers coming from outside of the area have some place that they can use facilities. Thank you.
Representative Pinto, for what purpose do you rise?
Mr. Speaker, I rise to point of order under Rule 3.21B, and I'm prepared to offer
Representative Pinto,
advice.
state your point of order.
So, Mr. Speaker, the point of order is under Rule 3.21B. Secondary amendments, Mr. Speaker, must relate only to the amendment, the primary amendment. In this case, the secondary amendment does not even touch the primary amendment. It's actually a section added a couple hundred pages separate in the bill. It's a policy that's not related in that way, and Mr. Speaker, I'd ask that you find the point of order well taken.
Advice to the Pinto point of order. The member from Sherburne, Representative Novotny.
Thank you, Mr. Speaker. It directly relates to the grant. The grant is through the DHS, and I can't understand how it could be more related. Thank you, Mr. Speaker.
Members, I have studied the amendment to the amendment and the amendment. I have reviewed the bill, and I have considered advice from Representative Pinto and Representative Novotny, and I'm ruling that the point of order is well taken.
Mr. Speaker.
Representative Novotny.
I appeal your ruling.
Representative Novotny appeals to the ruling of the Speaker. Discussion.
And I request a roll call vote.
Representative Novotny requests a roll call vote to appeal the ruling of the Speaker. Can I see 15 hands, members? Seeing 15 hands, there will be a roll call vote to Representative Novotny's appeal of the ruling of the Speaker. Representative Novotny.
Thank you, Mr. Speaker. Would Representative Hewitt yield for a question?
He will yield. Representative Novotny.
Representative Hewitt, back when you were still working, I assume that you had a duty belt similar to what the troopers wear in every day. You probably had a set of keys and a portable and some emergency equipment. When you were on duty, did you go to any gas station to use the facilities?
The member from Dakota, Representative Hewitt.
Mr. Speaker and Representative Novotny, I had to go anywhere I could go, but I also did report to a base of operation and were able to use those facilities there for whatever my needs were. Thank you.
The member from Sherburne, Representative Novotny.
Thank you, Mr. Speaker. I'm not going to go on and on about this. I think the point has been made. I think that the troopers do a great job, and I think that, once again, if the city's willing to accept the money that is going to help protect them, that they at least owe the troopers that are doing such a great job the ability to take care of what they need taken care of. Thank you, Mr. Speaker.
The member from Scott, Representative Albright.
Thank you, Mr. Speaker. Advice to you on that. Let's just be clear about what this amendment does. It creates a grant that by the amendment to the amendment puts conditions on that grant. Nothing more, nothing less. Members, please vote red to overturn the ruling of the Speaker.
Further discussion to the appeal of the ruling of the Speaker. Seeing none, I will remind.
Oh.
Who's seeking recognition?
Representative Pinto.
Representative Pinto.
Thank you, Mr. Speaker. Members, advice to the body, Mr. Speaker. Members, I just want to make sure that we're clear. This is not a condition on the grant. This is a program that is funded through MDH, through DPS, and through MnDOT. It's a broader program, and it makes a policy change to that program. It is not tied to the specifics of this of the funding that's in the couple hundred pages separate from the bill. Again, one way that you can tell that is that there's a series of sections relating to child care, and this section that is added in relating to this that would affect the whole program. Members, we should find that the Speaker uphold the ruling of the Speaker. Thank you.
Further discussion to the appeal of the ruling of the Speaker. Seeing none, I will remind the body that the question before us is, shall the decision of the Speaker stand as the judgment of the House? Members, a yes or green vote supports the ruling of the Speaker, and a no or red vote goes against the ruling of the Speaker. The clerk will take the roll.
He wasn't paying attention.
Go against his own.
Members who are voting remotely, please vote.
He's pulling the microphone apart.
Stop breaking things, Bodie.
Will the clerk please call the names of all the members who have not voted yet?
Ackland.
Ackland, no.
Ackland, no. Backer.
Thacker, no.
Backer, no. Grossel.
Russell, no.
Grossel, no. Hanson, R.
Hanson, R, aye.
Hanson, R, aye. Hausman.
Houseman, aye.
Hausman, aye. Kosnick.
Kosnick, no.
Kosnick, no. Kreshaw.
Kresha, no.
Kreshaw, no. Listlegard.
Listlegard, aye.
Listlegard, aye. McDonald.
McDonald, nay.
McDonald, no. Nash.
Nash, no.
Nash, no. Stevenson.
Stevenson, aye.
Stevenson, aye. Swazinski.
Swazinski, no.
Swazinski, no. Thompson.
Thompson, aye.
Thompson, aye.
The clerk will close the roll. There being 70 ayes and 62 nays, it is a judgment of the House that the decision of the Speaker shall stand. To the underlying Novotny amendment. Representative Novotny.
Thank you, Madam Speaker. Well, I'm disappointed. I'm disappointed, members, that you wouldn't join me and Governor Waltz and Mayor Fry and us on this side that saying that we should create division and issues between state patrol and local government. I hope we consider this as something that we can move on from and continue to support the men and women that support us. With that, I withdraw this amendment.
Representative Novotny withdraws the amendment. There's an amendment at the desk. The clerk will report the amendment.
Albright moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A59-1.
The member from Scott, Representative Albright.
Thank you, Madam Speaker. The A59 amendment reduces the bill, actually, get my story straight. The bill reduces rates for disability services in the remote setting. This amendment deletes those cuts. The telehealth language in the bill ensures that providers serving people remotely don't face those same cuts. It requires insurers to pay the same for telehealth as they would for in-person services. Members, if we are going to say every other provider will face no loss of money for providing services remotely, why would we cut funds for disability service providers? In 2019, the DFL had hearings on a bill which would have cut the rates for all disability services. This is just more of the same. The DFL always says, and I've heard this said in committee numerous times, that these budgets are moral documents. What does it say about their morals that the only providers who face a cut for providing services remotely are disability service providers? Let that hang there for a second. Madam Speaker, I request a roll call.
Representative Albright requests a roll call. Are there 15 hands? Seeing 15 hands, there will be a roll call. Discussion to the Albright amendment.
Representative Schultz.
Thank you, Madam Speaker and members. Well, the good news is that Governor Walz, through his executive authority, has authorized the use of remote services and extended that option so people can continue to benefit from this flexibility through the end of our public health emergency. In 2020, DHS had submitted a waiver to CMS to use same rates for remote services. CMS had denied that request, that waiver, and had very serious concerns. So right now, DHS is in the middle of putting together another request to CMS to adjust the rates so we can pay for those remote services. And we are awaiting their information from CMS. So if we do this prematurely, we may not have federal approval, and it could hurt our ability to be in compliance with federal guidelines. So I urge members to vote no on this amendment, and I hope to continue working on this in conference committee once we get information from CMS to go forward.
Representative Albright.
Thank you, Madam Speaker. I would just say that the points that's just made go to speculation. If you're going to keep pressing hard on that waiver, why would you cut these services in anticipation? Members, please vote green.
Seeing no further discussion, the clerk will take the roll on the 59-1 amendment. Members voting remotely, please vote. How many are you calling?
About 10.
13, 14?
Low teens, yep.
Will the clerk please call the names of the members who have not voted yet?
Grosso.
Aye. Aye.
Grosso, aye. Hanson, R.
Hanson, R, no.
Hanson, R, no. Hausman.
Hausman, no.
Hausman, no. Kosnick.
Aye.
Kosnick, aye. Kreshaw.
Kreshaw, aye.
Kreshaw, aye. McDonald. McDonald.
McDonald, aye.
McDonald, aye. Nash.
Nash, aye.
Nash, aye. Stevenson.
Stevenson, no.
Stevenson, no. Swazinski.
Brzezinski, aye.
Swazinski, aye. Thompson.
Thompson, no.
Thompson.
Thompson, no.
Thompson, no.
The clerk will close the roll. There being 62 ayes and 70 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Haley moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A95.
Representative Haley, to your amendment.
Thank you, Madam Speaker and members. The A95 provides retention grants for some of our hardest working folks. The recently passed federal COVID relief bill, the American Rescue Plan, contained a provision providing additional support for Medicaid home and community-based services related to the COVID-19 pandemic. The funding is generated from a 10% increase in the federal medical assistance percentage. For Minnesota's home and community-based service providers, this time-limited investment would be an incredibly helpful tool. The arrival of the COVID has been very challenging for all Minnesotans, but in particular, the system of support services provided by Minnesota's disability service providers is no exception to all of our challenging reality. It has been an incredibly difficult last year for these service providers. Since the pandemic hit, the direct care staff has been meeting critical needs all over the state. Staff have been providing essential services to the individuals that need them with no option that they could work from home. In the midst of a crisis-level workforce shortage, direct care staff have worked extra shift, longer hours, and provided a real sense of normalcy to the individuals that they support during a time when absolutely nothing was normal in their lives. Other disability service provider types struggled greatly with suddenly needing to find ways to best support Minnesotans with disabilities in their employment, their day enrichment, and other skill development goals at a time when service sites had to be shut down in order to protect folks' health and safety. The legislative language before you is aimed at supporting Minnesota Department of Human Services to direct a portion of the recently allocated federal funds in this manner that would support critical disability service providers to continue their mission to serve Minnesotans. The retention grants would be distributed on a quarterly basis beginning July 2021 and going through July of 2022. The retention grants could be used for things such as hazard pay, overtime pay, purchasing emergency supplies and equipment to protect the health and well-being of clients and direct care professionals. I urge your support on these retention grants, and I would ask for a green vote. Thank you, Madam Speaker and members.
Discussion to the Haley Amendment.
Madam Speaker.
Representative Moran.
Madam Speaker, I rise to a point of order, and I am prepared to offer advice.
State your advice.
Madam Speaker, the A95 Amendment attempts to authorize the use of dollars from the American Rescue Plan Act that was prohibited under the House Budget Resolution, line 2.11 through 2.18. And therefore, the amendment violates House Rule 4.03 and is out of order.
I've studied the amendment. I've reviewed the bill.
Speaker.
I've considered advice. Representative Haley. I'll take a little more advice. Representative Haley.
Thank you. I'm sorry for jumping the gun a little bit there. Madam Speaker and Chair Moran, there are other parts of this bill that direct federal funds. I think actually it's in Representative Pinto's part of the bill on the child care grants, where you are directing federal funds. So I believe that's already happened in this part of the bill. And I also believe fundamentally it's important for the legislature to call out our priorities for these federal funds. And my priority and the priority on my side of the aisle is to support these service providers who are providing just yeoman's work to the people in our community who need it the most. That is definitely where these funds should be headed. And when we're looking at more than 1,000 pages in this bill, where you are expanding government-run health care, you're increasing mandates, but we're not addressing this critical need and these workers, again, for the Minnesotans who need it the most, that's a travesty. I urge you to rule against the ruling of the Speaker. Thank you, members.
I haven't ruled yet, but I do find the point of order well taken. There's an amendment at the desk. The clerk will report the amendment.
McDonald moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A21-0189.
The member from Wright, Representative McDonald. Representative McDonald, you're up. Representative McDonald.
I think he's having technical difficulties, Madam Speaker. I just called him.
We'll come back to him.
Madam Speaker.
Representative McDonald.
Thank you very much. I was having some technical difficulties.
Well, lucky us, you're here now. I'm guessing you'd like to speak to the A21-0189 amendment.
I've been waiting since 11 o'clock, so thank you. So, members, my amendment has to do with the developmentally disability community. And it's a wonderful amendment. I'm disappointed that it wasn't in the bill in the first place, but I'm sure there's an explanation. This particular bill has been voted on by Representative Liebling and myself and many, many others in the past. And we are a little disappointed that it wasn't in the bill originally. But what it does, members, is it allows folks with developmentally disabilities to take charge of their life and to be accepted into communities and to live the quality of life that you and I live now. So what it does, members, is it's a statewide network of disability groups to maintain and promote self-advocacy services and support for persons of intellectual and developmental disabilities throughout the state. It's a wonderful event. Mary Kay Kennedy, many of you know, has been a champion for this movement, the ACT movement, Advocating Change Together. And it just gives those with developmentally disabilities the opportunity to live in communities, to take charge of their life, to be able to attend their sporting events, to attend and be active in their communities. And it's a wonderful event. Matter of fact, the Senate passed it unanimously. And Senator John Hoffman was our chief author. It's in Senator Jim Abler's bill. And I encourage a green vote because it's exactly what the state should be doing. Taking care of those who cannot take care of themselves. Allowing those with disabilities, developmentally disability, to be able to live independently, to be included in society, to be able to train other folks with disabilities to live independently. And it's a wonderful, wonderful bill, a great program. And I know that Representative Liebling has supported in the past. And members, I do support and ask you to support this amendment. I just want to briefly say, and I'm trying to bring up my notes here, members, I'm sorry. Sometimes when you're on a phone, you have to multitask. But members, in the Senate, they renamed it, and some of you will know, our good friend Rick Cardenas. Rick Cardenas was an advocate for the disabled community, and he was a fixture around the Capitol for many, many years. And I always had the opportunity to speak with him. He was a staunch supporter of any legislation that would further advance the independence of the disabled community. So in the Senate, they renamed this bill of mine, the Rick Cardenas bill, which allows those with disabilities to take charge of their life and to live the quality of life like you and I enjoy. So members, I encourage you, and Representative Liebling, please, I advocate for those with disabilities. Please put this in your bill. You didn't give us a hearing, don't know why, but please accept this amendment. And I encourage you, by the grace of God, to vote green. Madam Speaker.
Discussion to the McDonald amendment. Representative Moran.
Madam Speaker.
Representative Moran.
Madam Speaker, I raised to a point of order and I am prepared to offer advice.
State your advice.
Madam Speaker, and Representative McDonald, you know, advocating for the disability community has been a priority of mine in the legislature. It is something that has, you know, in my mind has been a bipartisan priority. But unfortunately, the A21-0189 amendment, unfortunately, it adds a new cost to the bill that will cause it to violate the limits of the House budget resolution. And therefore, under House Rule 4.03, the amendment is out of order.
Representative McDonald, did you want to offer any advice?
Thank you, Madam Speaker, Representative Moran. When we have the opportunity to help the disabled community, it is never out of order. Now, I understand that you already said the majority already set the rules earlier today when it comes to a bill that supersedes the budget and the budget of the bill. But it's never out of order to help those with disabilities. This bill was voted on by you, Representative Moran, and Representative Liebling, and many others in this committee, in this session, in this legislature. The fact that it was neglected and left out is an insult to the disability community. The bill right now will only raise the cost of health care, and it cuts $5 million to the disability community already. I don't know, as there's one thing that we should do as a state, but there's several things, but it's limited to. We really need to help those who cannot help themselves. And my bill does just that. It helps the disability community to take their lives and take their quality of the lives and present it just like you and me, Representative Moran. And it offers them an opportunity to train other people throughout the whole state with disabilities to take control of their lives and to advocate for themselves. That should never be out of order, members. Members, I ask you, is it ever out of order that we should fund a program that gives the disability community an opportunity to live the quality of life that you and I live? Is that ever out of order? Well, you know the answer. It is not ever out of order. Never. Members, I appeal the ruling of the chair, and we vote this. We need to support this always. Never out of order in helping the disabled community and those who cannot help themselves.
Haven't ruled yet. Willing to take a little more advice. The member from Chisago, Representative New Brindley.
Thank you, Madam Speaker. And it's hard to top what Representative McDonald just said. Helping the disabled community is never out of order. I would also add, based on our discussions this morning, a bill being out of balance is also not out of order. So I would recommend that the point of order be not well taken.
I find the point of order well taken. There's an amendment at the desk. The clerk will report the amendment.
Madam Speaker, I appeal the ruling of the chair.
Representative McDonald.
Yes, sometimes hitting the mute button, the unmute button, so you don't get background noise takes a little bit of time. But I appeal the ruling of the chair. Unfortunately, Madam Speaker, I have to do this.
I'm looking at your leader because technically we're on the next order of business, but
I appreciate your kindness to me.
We can go on back and do the appeal if your technology's in the way here. So, Representative McDonald, state your grounds for appealing the ruling of our august speaker.
Thank you, Madam Speaker. Well, I appeal the ruling of the speaker, and I hate to do this to you because you're a fine speaker, but I think that you know as well in your heart of hearts that it is best to really at this point, at this juncture, to support my amendment and to turn you over your own ruling to help the disabled community. And I don't say this just for fun, folks, and not just for an argument's sake. This has been something that many of us have been fighting for and working for the years that I've been at the session. I've been here for 11 years, and this is one area that I have focused my attention to help the community, the disabled community, immensely. And it's something you really don't get to talk about much when you're out in public, because you shouldn't be bragging about it, right? You do it because it's the right thing to do. Madam Speaker, I'm sure that if you search your heart of hearts, you'll know that you should overturn, if that's the right nomenclature, your own ruling to allow this not out of order so we can help this great community.
Representative New Brindley.
Thank you, Madam Speaker. Again, I agree with my esteemed colleague, Representative McDonald, and what we have now heard is that a bill that is out of order is, or a bill that is out of balance is out of order to a bill that is out of balance. And I would recommend voting to overrule the ruling of the Speaker.
On the appeal ruling, a yes or a green vote is with the ruling of the Speaker. A no or a red vote goes against the ruling of the Speaker. All those who wish to support the ruling of the Speaker, please say aye.
And Madam Speaker, can I call a roll call, please?
Those who oppose the ruling of the Speaker, please say no.
No.
It is the judgment of the House that the ruling of the Speaker shall stand. I could cut you slack once, Representative McDonald, but not twice. There's an amendment at the desk. The clerk will report the amendment.
Haley moves to amend House File Number 2128, the third engrossment as amended. The amendment is coded A60-1.
Representative Haley.
Thank you, Madam Speaker and members. And Representative McDonald's a tough act to follow, but here I go. I also care deeply about Minnesotans with disabilities, and I would agree with what has been said before, that these are bipartisan issues. I remember many, many speeches by former Representative Considine on that side of the aisle as he advocated for this. And although I don't serve on Health and Human Services this term, this still has remained important to me, and I was following Representative Edelson's bill, House File 740. And that is what my amendment is based off of, because I was very disappointed that that didn't get included in this 1,000-page Health and Human Services bill that increases mandates and furthers us down the path of government-run health care, and yet avoids helping our Minnesotans with disabilities. So what this amendment does, it would be three things. It will provide a 5% rate increase for intermediate care facilities, ICFs, across the state. It would adjust the services during the day rate from what they currently get is 75% up to 100%. And it would allow any facility to request what's called a variable rate for an individual when individuals have changing service needs. These rate adjustments are very, very direly needed. The last adjustment was done in 2015, and it was only 1%. To give you an idea of what these direct care professionals make, a full-time direct support professional starts at $13.39 per hour. A part-time direct support professional makes $12.36 an hour. We have ICFs all over the state that have open positions, and the folks that are continuing to work, particularly during these challenging COVID times, are extremely stressed and burdened, and people keep leaving this workforce in droves because you can't support a family on those wages at all, and you can't endure the hours and the stress that these jobs take without more support. This is incumbent on us to solve this problem. We all know it's there. It's been there for years, and we continue to put funding into all kinds of programs in Health and Human Services, but not address this one. This bill, in fact, provides massive operating adjustments to DHS. Massive operating adjustments to DHS, but does not support these rate increases. That's unconscionable, members, unconscionable. And I know we can come together on this and do the right thing. Again, we need to provide the 5% rate increase, we need to adjust the services during the day rates, and we need to allow for variable rate adjustments. I urge your green vote and your support on this amendment. Thank you, Madam Speaker.
Discussion to the Haley amendment.
Madam Speaker,
State your name.
this is Representative Schultz.
Representative Schultz.
Thank you, Madam Speaker and members. In this bill, we spend over $220 million in the next two bienniums to increase the wages for PCAs or direct support professionals, personal care attendants. We're spending a significant amount of money because we have been requested for many years that PCAs are underpaid. And I agree with Representative Haley. That's why we are increasing those rates significantly. Now, intermediate care facilities for people with developmental disabilities, we have been transitioning away from these institutions because there's a preference for people to live in more home-like environments in the community and away from the institution. So the last time we studied this, I believe, was in 2006. So we really do need to update and find out what the clients need and if they still prefer a home-like environment away from institutions. So we would love to fund all the needs of the people across the state. We have limited funds, limited resources. So this was not possible to do this year, and I do not want to take it out of DHS operating funds, because then we're jeopardizing other programs that are very important, for example, in compliance in those other programs. So we make a big investment for those who have disabilities to provide the services that they need, to pay higher wages for PCAs. And that's what Representative Considine was so passionate about. We are making progress and putting significant funds in this bill in that area. So members, I urge a no vote on this, and I hope we can find additional revenue, either through the federal funds, to fund this in the near future. And thank you, Representative Haley, for bringing this forward and for your concerns for those with disabilities.
The member from Candy Ojai, Representative Miller.
Thank you, Madam Speaker, and thank you, Representative Haley, for bringing this forward. I want to thank the members who brought forward the amendments before this. I understand they were ruled out of order, but it does not give the opportunity to speak. So I was pleasantly surprised to see that this one was not ruled out of order. Members, I have a disabled son, young adult, and when you have a disabled child, you tend to gravitate around other families that have disabled children. And then when you talk to them, you tend to talk to the organizations that support them and the services that support them and the people that support them. And Chair Schultz, I appreciate, and maybe I will be pleasantly surprised with where the funding is, but when I see these amendments coming forward, I have questions about that, because I can tell you that in recent years, when the funding needs to be increased in this area, it has either been flat or it has decreased. And some of these programs are starting to die on the vine. And members, it's not just about the money either. I challenge and I question the people that are making these decisions, because I just have learned over the last couple of years that I really don't think that they have truly listened to the families, to the organizations, to the people that are supporting those families and these disabled, special need children, adults. Minnesota is known for its care of people, probably almost to a fault. You hear a lot of times where we say, well, we shouldn't be spending money on this, this, or this. And we say, well, we're a state who helps. These are families that don't draw a lot of attention. They don't want a lot of attention. They just have very difficult circumstances. And it just boggles my mind that a state like ours cannot seem to figure out how to take care, as Representative McDonald said, take care of those people that can't take care of themselves. These are people that if we're going to have a safety net in our system, and Minnesota definitely believes in safety nets, if we're going to have a safety net, these are the people that we should be taking care of. And I will end with this. Representative Schultz, if your funding does the things that I'm hoping that it does, I'll be encouraged. I've been discouraged. I will tell you that I've now served in a majority, I've served in a minority. And in those years and in talking with people, we can't seem to ever get this right. So people of Minnesota, we need to get this right. I ask that you support the Representative Haley's amendment. Thank you.
Further discussion on the Haley amendment. Representative Haley.
Thank you, Madam Speaker. Thank you, Representative Miller, for sharing your experiences with your family and your son. Representative Schultz, I just want to clarify a few things for the members. The rate increases that are in your bill for PCAs, that's a good thing, and I applaud that effort, but that does not affect ICFs. So those rate increases don't serve these folks, so we've got to be clear on that. And in addition, you talked about the need to evaluate the future of ICFs, and that is true. But while the state can do that, it is unfair, given the high needs of people who live in ICFs, that it's just very dangerous what we're doing to literally starve them out. We don't have enough money in this state budget to support them. And when you talk about the operating adjustment for DHS, my bill in the first biennium needs $4.7 million, and only one part of your operating adjustment is over $16 million. I'm asking for a quarter of that. And that operating adjustment for DHS is for wages and other things that the state needs to learn how to live within its means, while we are literally denying people with disabilities proper services and the people that care for them proper pay. I urge you, Representative Schultz, to be good on your word and continue to work on this. I know there's some work on this in the Senate. And please bring us back a bill at the end of a session that funds these ICF service providers. Thank you, members, and I ask for a green vote. Thank you, Madam Chair.
All those in favor of the Haley Amendment, please say aye.
Aye.
Aye. Those opposed, please say no.
No.
The motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Robbins moves to amend House Bill number 2128, the third engrossment as amended. The amendment is coded A81.
The member from Hennepin, Representative Robbins.
Thank you, Madam Speaker, and thank you, members. This amendment is a follow-up to a bill that Representative Lippert brought, HF 663, which part of his bill is incorporated in the underlying bill, which addresses rate increases for the PCA program. But the part that was left out is the part that deals with program integrity. And so all along, we've been talking about the need to make sure that we are addressing program integrity in terms of internal controls by the providers, and also that the department is doing its job in following up on claims of fraud or abuse, or making sure that the PCAs are properly trained, that sort of thing. So my amendment takes the language that was in Representative Lippert's bill and just is an amendment to this bill so that both pieces are in the underlying bill. So members, it's really important that we not only give the rate increase, but that we are upping our game in terms of program integrity. And so I just want to talk about it for a couple minutes. This is really kind of basic stuff that I was honestly surprised to find out it wasn't already going on. So it makes sure that PCAs have to notify DHS when they move between agencies. It requires better documentation for their services. It requires PCA agencies to provide DHS with a copy of their procedures relating to their own program integrity, how they monitor hours worked and that sort of thing. And it requires PCA agencies that start with the state for the first time to have to submit proof of financial wherewithal. And so these are kind of common sense things that has been talked about they should be doing already, and it was in the Lippert bill originally, so I would just encourage members to support the amendment.
Discussion to the Robbins Amendment. Representative Schultz.
Thank you, Madam Speaker. And I do have a secondary amendment, 113, that I would like to offer.
There is an amendment to the amendment. The clerk will report the amendment.
Schultz moves to amend the Robbins Amendment to House File Number 2128, the third engrossment as amended. The amendment to the amendment is coded A113.
Representative Schultz.
Thank you, Madam Speaker and members. The A13 secondary amendment just specifies the amount of money, $1.5 million per year, per year in the biennium to go to program integrity to pay for this program integrity language that Representative Lippert and now Representative Robbins are bringing forward.
Discussion.
And I urge a yes vote.
Discussion to the Schultz amendment to the amendment. The author of the underlying amendment, Representative Robbins.
I urge members to support the Schultz amendment, and I thank you very much, Madam Chair.
Seeing no further discussion, all those in favor of the amendment to the amendment, please say aye.
Aye.
Those opposed, please say no. The motion prevails. The amendment to the amendment is adopted. On the underlying amendment, discussion.
Madam Speaker. This is
Representative Schultz.
Thank you, Madam Speaker. So we did receive feedback from DHS that the language needs more work, and we can do this in conference committee. That's why we did not include it in our final bill. So we're going to continue working on it, but I urge members to accept the A81 amendment. I'm actually quite surprised that my Republican friends would support this because it's more positions that will be funded at the agency. So I guess you could call it an expansion of government.
Discussion to the Robbins amendment. Representative Robbins.
Thank you, Madam Speaker, and thank you, Representative Schultz. We do support this because program integrity is so important to providing the best services to Minnesotans and to providing the best, most effective use of taxpayer dollars. It's been something we've been working on for years, and if I wasn't going to talk about this too long, but I'm just going to look at, I guess I can't show you, but I've been reading the OLA reports from 2009, which is the first OLA report on PCA program integrity, and then another one from March 2020. These programs integrity problems in the PCA program stem from 2005, members. Then the OLA report came out in 2009. Then the legislature passed some changes in 2013. Now we had another OLA report last year in 2020, members, and so many of the things that were still talked about in 2005 and 2009 are just being addressed now by this bill. So it's very important, and I appreciate the chair's recommendation. And to that point, I agree that there's other program integrity issues that need to be addressed in the conference committee, Chair Schultz. So I'm glad that you are going to continue to work on that. And one of the specific things I'd like to get on record is that this addresses the PCA program as it stands, but as it switches to the community first supports and services, I can't remember if I'm saying that right, but as it switches to that new framework, I hope that these reforms that we're passing tonight will go into that new framework that starts next November. So members, I encourage a green vote. Thank you.
All those in favor of the Robbins amendment, please say aye.
Aye.
Those opposed, please say no. The motion prevails. The amendment is adopted.